Good evening. It's 7 o'clock, and I'd like to welcome you to the August 11th School Committee Board meeting. This meeting is being held virtually through Zoom. The town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring, but it is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room which are not incorporated into the public record. In response to these concerns, the town will implement the following changes which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you called in by phone, please use *6 to mute or unmute your phone. So that the meeting can occur in an orderly fashion, we ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request the participant return their microphone back to mute. Okay. All right. So we do have minutes from June 17th, 2020, and oath to bills and payroll. Okay.
I make a motion to accept the minutes and the oath to bills and payroll from June 17th, 2021.
I'll second the motion.
Motion made and seconded. This is a roll call vote. Timolin?
Timolin Rossius, yes.
Justin?
Justin McCarthy, yes.
Jen?
Jen Gold, yes.
And Brad?
Brad Austin, yes.
Matt Hunt votes yes as well. Okay. So this brings us to our first public comment section of the meeting. I'd ask that all comments regarding mitigation strategies, including mask wearing and pool testing, be held off until we bring that into the meeting. So if anyone has any general comments, feel free to raise your hand now. Any other hands raised? Dorothy?
I have one moment. Mike Fontanello, please state your name and your question, please.
You can't get rid of this guy.
Hi, this is Mike Fontanello, 213 Harwood Avenue. I just want to mention that I believe that the traffic light for the high school intersection looks like it's finally going in. And I just wanted to get confirmation of that from the administration, and also remind everyone that it was Daryl Baker and Chuck DeCoste who refused to take no for an answer over the years. It's taken us literally years to get that done. And those were the two primary guys who absolutely didn't let the state tell us that the standards that they have for where and when they put lights in was going to be a sufficient reason for telling them that we couldn't do it there. And we're very fortunate that those guys pushed that hard to get that done. It took a lot of effort, but it looks like it's coming to realization.
Yes, Mike, it's going in. It's scheduled to be finalized sometime in mid to late August. Since we're approaching mid-August already, I haven't checked with them, but that the initial schedule was it should be done before September, but that may be delayed a little bit.
Awesome. Thank you.
Thanks, Mike. And anyone who's tried to pull out of the high school at certain times of day knows how difficult that can be, especially for recent graduates of a driver's ed program. So we do appreciate Daryl and Chuck's tenacity in getting that put in place. All right. Right now, I'd like to turn it over to, we have a FinCom school representative interview. Elvin Rasmus has applied to be our representative for FinCom. Is Elvin with us, Dorothy?
Yes, he is.
Hey, Elvin. Do you want to tell us a little bit about yourself, Elvin, and what your experience is?
Yes. So this is Alvin Rasmus, live at 139 Foster Street. And my experience is in the corporate world, had many different financial positions. I'm currently overseeing finance and administration for a software company down in Boston. And previously, it was about 8 years ago or so, I was on FinCom for Littleton. But the job that I had required me to travel significantly and spend a lot of time in Connecticut. So I stepped down at that time, and the last 8 years I have been pretty busy. Not an excuse for not helping out in town, but I have been pretty busy. And the company, the software company that I just mentioned, we finally finished off a transaction and sold. So my life is now less cluttered, and I have more free time and the ability to help out more. And then I heard recently that somebody was coming off of FinCom and there was an opening. So I reached out to see if I could possibly come into the role.
Great. Thanks, Elvin. Appreciate your interest in the position. At this point, I'll accept a motion to, if anyone would like to approve Elvin Rasmus as our school committee representative to FinCom.
I'll move that we appoint Alvin Rasmus as the student school committee representative of FinCon, and thank him for doing so.
Second that motion.
Motion made and seconded. This is again as a roll call vote. Brad Austin,
Brad Austin votes yes.
Jen Gold,
And Gold, yes.
Justin McCarthy,
Justin McCarthy, yes.
Tim Linrasius,
Tim Rossius, yes.
Matt Hunt votes yes as well. Thanks, Elvin. We appreciate it. Look forward to working with you.
Thank you. I appreciate it, guys.
Thanks, Alvin.
Thank you,
Good luck.
Elvin.
Okay, so this brings us to the new business. And first, we have an old friend visiting us. Katrina Wilcox Hagberg is going to give us an update on the COVID-19 health metrics.
Hey, everyone.
Hi.
I'll be honest, I didn't want to be back here. Not that I don't like you guys, but I don't like COVID. All right, I'm assuming you can see my slides.
Yes.
Thank you.
Okay.
All right, so I'm gonna jump right in, right off with a review of the Delta variant and how it's really changed the game. And I'm hoping that starting this way will really help to explain the state and local metrics that follow in some of the guidances. So Delta is highly infectious, and on average, when no mitigation is used, a single case can spread to an average of 5 to 9 people. And at this point in time in the US, Delta is the only circulating variant, essentially, which is what you can see on that image right there. It's grown very quickly over the last few weeks. Delta replicates faster and has a higher viral load, and that means people infected with Delta are more contagious and contagious faster than after exposure to prior strains. And it has lowered the effectiveness of the vaccines a little bit. So the vaccines were, like Pfizer was 95% effective against symptomatic disease, and now it's between 80 and 85%. Now, keep in mind, this is still really good. A year ago, we were hoping for a vaccine that was 50% effective. So the fact that we still have an 85% effective vaccine is amazing. We just have to keep watching this data to make sure that it's not actually lower than this. So because the effectiveness of the vaccines are lower, it means that we can get breakthrough infections more often now. They're still pretty low. A low percentage of all infections seem to be from fully vaccinated people. But that does mean that vaccinated people can spread to other people at this point. And reinfection with Delta after a natural infection is also impossible. So even prior immunity through infection isn't as effective as it once was at protecting yourself. Both vaccines and natural infections do improve your immune response, and you will have an immune response to it. It just may not be as robust as we had hoped against Delta. And it is possible that Delta may confirm more severe disease. This is something that's because Delta is new, it came on, it came strong, and we're catching up on this. There's some evidence of concern and some evidence saying it's not a big deal and that it's not different than the original and the Alpha strain. So there are lots of things here that we need to learn, and we need time and data to do that. But what I can't emphasize enough, I know I just said that the vaccines are a little less effective, but the evidence is still really clear that these vaccines that we have prevent a lot of symptomatic disease, hospitalization, and death. And if you get sick, the symptoms are usually milder and a shorter duration. And one thing I have to say, that outbreak in Provincetown after the 4th of July really put our vaccines under a major stress test. And the data was clear that the vaccines did a great job doing what we wanted them to do, which is to prevent hospitalizations and death. And in fact, a few weeks after that outbreak, the rates in P-Town actually receded. So vaccines also help to put a lid on it. And the best way that we can protect kids who are not eligible for vaccines right now is to get as many adults and eligible siblings as possible around them vaccinated. So I want to do a little epi math. And to me, this really helps me understand why Delta really changed the game. So this slide summarizes the effective reproductive numbers, which is, it's an epidemiology thing that gives us an idea of how readily an infectious disease will spread. So R is the estimate on how many people one infectious person will spread to. If R is greater than 1, then ongoing spread or outbreaks are likely. It depends how big that is. And then if R is less than 1, then the virus won't spread and eventually it will fade away on their own. And R can be impacted by vaccines, natural immunity, or also mitigations that are policies that are in place to help prevent spread. So all of these things work together to lower R. So if you see in this yellow section here, we have the R naught against the original strain and the Alpha variant. Right here, this is what's called the base case, that the original strain or Alpha spread to 2 to 3 people. And
Katrina, can I interrupt for 1 second? So when you're describing what the Alpha original variant did, are you describing its most recent kind of the way it was functioning as a virus, or at its this time last year, or what are we comparing this to?
Alpha, so the original, great question. So this is 2 to 3 was kind of like where the original strain was. Alpha increased it to 2.5 to 3.5. It was more infectious, it spread more, but it was still in the 2 to 3 range. It wasn't, and with all the mitigations we were seeing, it was hard to tease that out. So I'm going to say 2 to 3 here, because the field of infectious disease epidemiologists have kind of landed on 2 to 3 for both the original and the Alpha variant.
But I'm sorry, but this is when we're
talking this 2 to 3 number was last September.
Okay, that's what I needed. Thank you.
Okay, thank you. So this 2 to 3 number is last September, and then all winter we were using all the other tools we have to try to slow the spread. And then when vaccines became widely available and a lot of people had them, and remember they're 95% efficacious against the Alpha variant, we managed to lower the effective reproductive rate, this RE, to 0.6 to 0.9, which is less than 1. So that's why last June we were told we could take off our masks, and rates still kept going down because Alpha was the dominant variant, and we weren't having spread because we had lowered the RE through vaccines. So then Delta came along. And the evidence currently it's pretty wide range. People are still trying to sort out the R naught for Delta, but right now the range is 5 to 9. That's the lowest I can find and the highest I can find. So somewhere between 5 and 9 people, one case will spread to 5 to 9 people. And our vaccines with Delta appear to be about 85% effective. So I'm using that number in this calculation. And we still only have 72% of Littleton is fully vaxxed. We've been that way since mid-June.
And I'm sorry to interrupt. So that's 72% of the eligible population or total population?
Total, because kids are part of our population and therefore need to be accounted for.
Thank you.
even though they're not eligible for vaccines yet. So 72% of all Littleton residents have been fully vaxxed right now. So these numbers go into this equation. And when we take into account vaccines, we lower the RE from the 5 to 9 down to 2 to 3.5, which is a huge benefit of vaccines, is that they take them down that far. That's a great improvement. But of course, the most frustrating part of this, if I look at this and it makes me want to cry, is that we're essentially where we were last fall against the original and the alpha variant with the 2 to 3 when we're looking at something that's 1.9 to 3.5. So that's why we're all frustrated and we're being told to mask, and that's why we don't quite get it. So that doesn't mean it's our only tool, though. We have other things we can do to lower this, slow the spread, lower this thing. So one of the things we have is masks. So if 25% of Littleton residents start wearing cloth masks, so cloth masks are estimated to be 50 to 60% effective, and 25% of people start wearing them, then we can lower the RE to 1.7 to 3.1, which is not much different than just the vaccines, to be honest. However, if most people, 90% of people start wearing masks, then we can lower RE significantly, closer to 1 to 2. So that's where like the number of people who wear masks really matters, even if the mask is not the best quality mask in the world. So I do want to be clear about this because a lot of this is hinging on our vaccines aren't as good. I keep saying that, but I have to tell you, vaccines and masks are both most effective when lots of people are vaccinated or lots of people wear them. And our vaccines are still very effective. We brought that just with vaccines. We're not 5 to 9 anymore. We're 2 to 3.5. So we have good tools. We need to use them.
Katrina, quick question.
Yeah.
Where does the data come from that is used to calculate that sort of 25% or 90% usage of masks and the relationship between that and the RE change?
Yep, great question. So I know I sent you guys a whole spreadsheet on this before, which is where I was referencing a lot of things. I pulled the 25% and the 90% of people using masks were just me running scenarios. So me saying, well, if there's a mask optional order, or right now at this moment, 25% of people are wearing their masks, this is what the number would be. If more people start wearing them, let's say 90% because there's a mask required, mask order, then that would be 90% of people wearing them. So that is literally just
I'm sorry, I'm just wondering.
building.
I get that. Sorry. Yeah, go ahead.
The effectiveness of the masks has been summarized in published literature. I personally pulled the one from the CDC because they had 65 studies. They summarized and they have said that they are 50 to 60% efficacious. I've seen that in other publications as well. So that seemed like a reasonable estimate. We can lower this to 30%. We can raise it up with better fit and quality masks. We can raise it up to 75%. We can play with this number depending on what mask people are wearing. I picked the 50% because that's the one I got from the CDC.
Okay, so these numbers are based on an assumption based on the CDC data that masks are 50% preventative, meaning that wearing a mask would cut the chance of you getting COVID in half. Am I getting that right?
That they are effective at cutting the chance of COVID in half. Yes.
Okay. Thank you.
I had to remember which research part that was. The CDC has this really detailed scientific document on masks. If anyone wants to read it, I'm sure people have, but everyone good with this one? Because I want to go on to the metrics now. So keeping in mind that we're now, our RE has us growing again. It's above 1. But we haven't had any other mitigations other than vaccines in place at this point, still to this point. We're going to look at our metrics through that framework now. So right now, 64% of all Massachusetts residents of all ages are fully vaccinated. Middlesex County has 67%. Worcester County has 58%. We sit on that border, so something we should be keeping an eye on. But it's really been a blessing in our state that and has really helped to prevent that surge we're seeing in southern states and other states, that we have so many people who are fully vaccinated. So this is a great thing still. And then this is the overview of all the trends from the DPH data. I pulled this today. So the good news is that the high vaccination rates I just showed you are helping to keep things from growing off the charts rapidly. So no surges at this point in time. The 7-day average of COVID cases is around 800 per day. 7-day average is 800, similar to where we were at the beginning of May. And also, if we're looking back to the fall, that's where we were in mid-October. So that means that we're going to start school this year with more circulating cases than we did in 2020. The 7-day average of test positivity has grown over time. It's now 2.91%. Again, this is low. This is good, but it's also trending higher. So something to keep an eye on. I do have to say the hospitalizations and deaths are showing that our vaccines are working, because despite being a month into the surge, we don't have the same rapid increase in hospitalizations and death that we had in prior, last fall, for example. So the average number of hospitalizations, people in the hospital a day, is 293 today. That's the report. That was where we were at the end of May, but also where we were at the early October last year. And then the 7-day average of confirmed deaths is low, which is awesome. It's now averaging 3.4 a day. So 3 per day. Okay, so the other thing we should always be keeping an eye on at this point is the rates by age group. So this is the case rate per 100,000 for the last 2 weeks. The state puts this out per age group. So I broke it down into student age groups and adult age groups. That would be the age of teachers and parents, just so we can compare them. Figuring that these are the people who are in your buildings, you should know about them, or directly in contact with their students. So when we break down these case rates, you can see that all age groups are trending higher, and they're actually higher, considerably higher than where they were than I only chopped this data off at the beginning of June when all of those restrictions were lifted. So since we last spoke, this is that data. This is what the line looks like. The rates in all age group, like I said, has risen week over week. The 20 to 29 and 30 to 39 age groups have had the highest rates over the last few weeks. And the rates for kids 5 to 9, 10 to 14, and 15 to 19 are all right now about 150 to 200 cases per 100,000 people, which that's starting to escalate. And the rates for adults right now, 40 to 49 and 50 to 59. So we're calling those parents, your teachers, things like that, is a little bit lower. So 125 to 150 per 100K. Household clusters are still holding at 2.4 cases per cluster. So households are still a predominant mode of transmission, but there's also been a number of social events, restaurants, camps, and athletics, and childcare clusters documented over the last month. And because these are the age groups impacted, you can really see this with these age groups.
Hey, Katrina, can you help me put this in context then?
Yep.
So clearly we had a dip, and then since July, there seems to be there is an upward trajectory.
Yeah. Yeah, let me pull the...
help me understand what's happening at the school age kid level compared to the numbers you were showing earlier about the 1.9 to 3.5 replication rate. Do they match, or am I?
That's a really great question, Brad. And I'm glad you asked it, because I would have forgotten to say it. So the nice thing is, we are not, because we've got so many people vaccinated in our state, we are not doing the 5 to 9. Like, that's not 5 to 9 growth. That's not a 5 growth. That's like 2 to 3 growth, so our vaccines are doing what I just said. When our vaccines brought it down to 2 to 3, that's what we're seeing. We're seeing a 2 to 3 growth.
Well, I guess that was my question. Or is this trend line consistent with what the other data are showing, but in the school age population?
Yes.
Okay, thank you.
Okay, so let's go to town data. The most lovely thing is we had 0 cases for a few weeks there. So the good news is the absolute number of cases that have been documented in Littleton itself is very low. So we had 5 cases reported over the second half of July. That's the data that ends through July 31st. We don't get the next update till tomorrow, so we'll have to keep an eye on that. But you can see that we went 135. So we're not quite doubling. But we're on pace basically.
Excuse me, Katrina?
Yeah.
Do we know if those 5 cases are all in one household, if it's a cluster, or if it's 5 separate
I don't know that answer.
Okay.
It's a really good question. I listened to the Board of Health meeting, the last one, so 2 weeks ago. And
Yes, I listened too.
yeah, they can't tell us. It's possible that's one household, or at this point, it's possible that it's 2-3 households, depending on how that happens and what, we don't know. But the good news is its absolute number of cases is low right now in Littleton, or at least was last week.
Katrina, this might be a simple question. Is the greater availability of at-home testing messing with our numbers some?
That is a really great question. And I was wondering that as well, but I don't know how to figure that out. It is very possible. And it has been hypothesized in other countries and other states that is part of the reason we're not capturing all the cases. Our testing numbers are not, they're like a third of where they were at the
It
peak.
could go either direction, right? It could be that we're missing all the negative cases that otherwise would be tested, or we could be missing some positives that are asymptomatic. And
Yes. The one thing that makes me less worried about missing all the negatives is that our test positivity isn't through the roof. So we're still at 2.9 for today. So the good news is that it's growing, but yeah, it is quite possible that the at-home tests have changed the testing landscape, and I don't know what the impact of that is on our numbers yet.
that's fair. Thank you.
Okay, so this is that average daily incidence rate over the past 14 days. Again, our data for this is from last week's report, so it's through July 31st. And this is, excuse me, I'm already going hoarse. This is where we've made it per 100,000 so that we can compare all those different areas that we've been tracking from the beginning. Again, I started this data this data would have gone from the beginning of June through the end of July, just because that's when all of the restrictions were lifted. It gives us a smaller snapshot to focus on. So as you can see, the entire state, our county, all of the surrounding communities, 495 belt, everything's been trending higher week over week. And at relatively the same pace. Littleton's a little lower, which is great. So again, the next update's going to be tomorrow. So we'll have to see where this goes. And then when we look at the testing data, again, all of the areas, no matter which one we look at, are all kind of landing in that 1.5 to 2 range last week. So we're going to expect that to be higher this week if we look at the state data. But in Littleton was a little lower because we had 5 cases. So our testing numbers are not strong right now. So Littleton's testing numbers we just don't have a lot of people getting tested. So it's hard to tell what's going on here, but the trend is with everyone else. So the trend is what it is.
Katrina, I have a question. When you say the testing numbers aren't strong, are you implying that the numbers should be higher? Like, should more people be testing? Or I'm guessing that if you're asymptomatic or haven't been exposed, you don't test. So am I missing something, or should people be testing more frequently just as a precaution?
So that's a great question. So we are somewhere, I think it was like 500 tests in that 2-week period at the end of July. And that could be impacted by a lot of different reasons. One is a lot of businesses stopped doing surveillance testing for their businesses once people are vaccinated. So that cut down on our numbers because there were a proportion of people in town who were getting week over week testing. That's no longer present. There was just less COVID. We only had 5 cases. And our rates aren't astronomical. Our rates are actually pretty good. So there's just not a lot of people are having close contacts and exposures that require testing. And up until, I don't know, the end of July, the CDC said that if you were vaccinated and it's been 3 months since you got vaccinated, you didn't have to test. And then they just changed that recommendation at the end of July that said that even vaccinated people should be seeking testing after an exposure or close contact. They should be testing 3 to 5 days after. So my guess is at this point, because of some changes in guidance, we're going to start seeing more testing rolling in than we did before, because the evidence changed and we've changed our policies and guidance, and things will start happening. There's also just more COVID around. So people are more likely to become a close contact at this point. And then there's also that rapid test issue, over-the-counter rapid test issue, that we might be missing a portion of people. So that said, if someone has a rapid test and it doesn't get reported, and they're positive, I still hope that they're doing the right thing and staying home or isolating, just because that's the right thing to do, even if it's not reported. So people can still do the right things, even if it doesn't hit our numbers. It just makes our numbers a little more limited in what we can conclude from them. So right now, I don't have evidence to tell you how undercounted we might be. And so we'll just have to see how this goes over the next few weeks. Does that make sense? Okay, so this is one of our most important things, is our vaccination coverage for our town. I'm very grateful that our state provides vaccination by municipality. They do it by sex, by ethnicity, and race, and by age group. And our numbers are pretty balanced on race, ethnicity, and sex. So we're focused on age group specifically because that will impact the policies you guys think about. And it also helps us with that age-based eligibility to think about how each group might look at this point in time. So Littleton has done an amazing job with vaccinations. 72% of all of our residents, kids included in that number, are fully vaccinated. That's above the state average. That's above the national average. That is amazing. Everyone can give themselves a pat on the back. In terms of school-aged residents, 76% of our 12 to 15-year-olds and 74% of our 16 to 19-year-olds are fully vaccinated, according to this DPH data. And that is, again, amazing that within weeks of their eligibility, those young groups have gotten largely, 3 and 4. 3 out of 4 students have gotten vaccinated, or kids in those age groups have gotten vaccinated.
Katrina, can I ask you a question here? So partially vaccinated, is it as simple as they've gotten one but not the second shot?
Yes.
Okay. So do you think it's safe to assume that 3 weeks from now when schools start, it's more or less safe to add column fully plus partially?
I wish. I really wish.
Okay, but
it's unfortunately the 6% partially vaccinated is kind of stuck here since the middle of June. I can see when we look at the age distribution numbers, like I think last week, the 12 to 15-year-olds are at 6% partially vaccinated. And this last report, they were 12%. And I am going to applaud every parent who said, I want my kid fully vaccinated by the time school started. So they went and got it in the middle of July. That's amazing. But other than that one age group, nothing has budged.
Well, that's what I was looking at. We're most concerned with school age groups. So if we're looking at 88% fully vaccinated 3 weeks from now, or close to it, and 80% fully vaccinated, that seems significant.
It would be significant. Absolutely. I think our kids, like our parents and our kids who've gotten vaccinated, are amazing. I'll get into
Katrina, I
that
have
a
a
little
quick
later.
question on that.
Yeah.
Brad, I was thinking along the same lines. You also have the absolute number of people, though. So although the percentage might not be changing, if you have got people moving out of the not vaccinated into the partially vaccinated, it would be safe to assume that we are chugging along in the right direction.
Yeah, that's like budget a few people at a time. It's really slow.
Well, it's going to get slower the more people we have because you're running out of people to vaccinate. But
yeah, we'll keep an eye on it. I really hope that people over the next few weeks get from that not vaccinated column to that partially vaccinated column.
Right. I would be curious, maybe Jim Griffey could get us that information on the sort of the absolute number of people. If there is
this
any
is
movement.
The absolute number of people. I can do that. Week over week. I have all of those reports.
Okay, so you could look at that, like, for example, one of the age groups and see if people are actually moving out of the not vaccinated. Okay, that'd be great. Yeah. Thank you.
But the other qualification is that we're not sure all of these Littleton 14-year-olds are going to Littleton Public Schools.
That is actually a really great point. So I am making an assumption that there's no difference, no reason to assume that Littleton Public School children would be vaccinated at a different rate than children in Littleton who attend different schools. That's an assumption. The best thing we could do would be to actually get numbers directly measured on the student population and staff, if we could. Does that make sense?
It does. My takeaway from this is Littleton's doing pretty well here.
We are.
Okay.
I will give us
especially
credit.
in the age groups we're most concerned about that are eligible for vaccinations. In schools.
Now, I will say, when I'm looking at this, I see, this number says around 60, 12 to 15-year-olds have not started getting vaccinated yet. They're in that not vaccinated category. Just over 100, 16 to 19-year-olds are in that category. And then when I look at parents, because household spread is still a thing, I'm looking at closer to 400 adults in this town who have not yet started getting vaccinated. Age 30 to 59. So those would be, so while these numbers are excellent, they can still be improved. And any improvement in the amount of people who get vaccinated is the more protection for everyone, the less disruption, the less spread, more protection against severe disease, hospitalization, and death. So I would say this about every age group. I'm just pointing out the age groups relevant to your meeting.
Katrina, one more just I'm curious about that 75 plus. I don't know. I know that it doesn't factor into the conversation really tonight because it's not the school age population.
I have asked the Board of Health about this.
It's like, it's just disappointing. Unless there's an explanation, I'm kind of wondering what's going on there.
I did ask, so that number has been bothering me. And I've mentioned it to the Board of Health who have been working with the COA and like, can we figure out who we're missing in that group to just reach out and talk to them? See if they just need a hand getting a ride to the pharmacy or whatever it is.
Yeah.
I want improving that number. If you know someone in this age group, if anyone knows anyone in this age group that we can talk to, let's talk to them. Like, let's encourage them to get vaccinated. They are at the most high risk of the worst outcomes. I would love to see that number budge. But unfortunately, I don't know who they are or how to get to them. So hopefully someone else does.
Right. And the reverse is true. I'm like blown away at the vaccination rate of the 20 to 29 and the sort of the parent group you just called them, the 60 to 65 to 74. That's like, if so I'm adding column, if I am adding column A and column B together, because I'm assuming that if you got stuck once, you're probably going to go ahead and finish it out.
Careful with that assumption. Careful with that assumption.
Anyways.
Yeah.
98%. It's like unbelievable. So
the reason I have only been focusing on fully vaccinated people is because against Delta, that partially vaccinated group is the effectiveness of one dose is like 30%. So it's not great. And so to me, like getting everyone to that fully vaccinated state is really important. And I think there are reasons that we might see that 12 to 19 group spend more time in the partially vaccinated category, as some individuals might be spreading out the 2 doses in that age group for concerns about adverse events, vaccine-related adverse events, things like that. And people have talked to their doctors and started doing stuff like that. So I can see that number might take longer to dwindle into the fully vaxxed group, but I think they'll get there eventually. But then there's just probably some data recording snafus and someone's in the wrong town or whatever. So that stuff happens too. But I think overall these numbers are reasonable given our population. I did check the total number of people and by age group against I asked the town to check it against our census data because I was like, this doesn't feel right. And we are, the numbers the state uses and then our census is essentially right on. There's actually a little fewer people in that 75, fewer people in that 75 plus age group. So that fully vaccinated group is probably a little bigger percentage wise because there are fewer people in that age group and there's more people in the 20 to 29 age group. So that one's probably a little lower, but overall for the age groups that you care about, this denominators were very close to our census. So I checked the denominator just because I didn't believe it at first.
Got it. Thanks.
Okay. So the other thing you guys have probably been seeing is there's a lot of talk about this CDC community transmission rate. This has been used in their guidances. This is built right into some of those school guidances. So this is something I think we should talk about. So the CDC publishes these community transmission rates by county and uses these in their recommendations. And they base it on 2 indicators, the total number of new cases per 100,000 people in a 7-day period, or the test positivity rate. The categories are right there. And they use whichever one has the higher color, if you will, if they're discrepant. So as of yesterday, Middlesex County had 82 cases per 100,000 people, and it has been trending higher week over day, actually, week over week, indicating that, and that's, so we're orange, we're in the substantial transmission group, and much of our state is with us, especially the area of the state we're in. And there's unfortunately a few counties that are in high transmission rates. I do have to say, the one little nice thing is that the Cape after the 4th of July was in that red high transmission category, and it's gone back to meet the rest of the state in substantial. So it is nice to know that we can go back to still. So there's this.
Katrina, county seems like such an imprecise measure to me. I think Littleton, looking at Littleton alone is probably too small. County, especially a county as large and as different as ours in terms of communities.
And we sit on the border of them.
Yeah, and we sit on the border. And I guess if we're surrounded by orange in every single way, then maybe I shouldn't worry about being grouped with Middlesex or not. But that just seems like a really imprecise, especially the way the guidance is structured based on county kind of numbers. That seems imprecise to me, or too blunt an instrument.
So it's too blunt of an instrument, but I can do some math for you. So what I've done is taken the CDC community transmission rates. All of our test positivities are in low, which is awesome. So I didn't bother tracking that for you. They doesn't really show anything yet. But when we look at the rate piece, so the total number of new cases per 100,000 in the last 7 days, and track it week over week since June 26th, data came out. This is what it looks like. And so we can look at the state, Middlesex County, our 495 belt, our surrounding counties, our border communities, and Littleton itself. And we can see that we've all trended in the same direction at essentially the same pace, and we all land in essentially the same spot. And the state's a little higher than our area, but we're somewhere between, I think it's 58 per 100,000, and the state is now 82 per 100,000. So we're in that orange substantial transmission band, and we're there all together. So I think that orange that you're currently seeing in that CDC graph is very reflexive. It's actually good for what you, it's a good indicator. Everyone looking at that graph right now knows that we're all in the same place. If that makes sense.
It makes sense. Thanks, I guess.
So just the CDC came out with a new recommendation that anyone in the orange or the red categories, so substantial or high, should, they advise that everyone, including vaccinated people, should be wearing masks in indoor public locations. So I just wanted to share that little bit of change in guidance. Okay, so then I, out of sheer curiosity, wanted to take our health notification letters and compare it to these, this total new cases over per 100,000 for 7 days for just Littleton. Like what is, because we've been talking about when community prevalence increases, there's more likely to find a case in your school community. Once you have to find a case in your school community, you're increasing your risk for transmission events in the building. So let's talk about that first step, that when our community rates increase, are we actually seeing cases that are reported among people in the Littleton public school community? That doesn't mean the case they were in the building at the time. There's just, what did we get a health notification letter that said we did? So from this data, it's very clear that as our community rates increase, so did the number of cases that in those health were reported in those health notification letters. And so like we had 1 week where we were in the low category and we had 0 cases reported from the school that week. We had 11 weeks, and this is the whole school year. So there's some caveats to that, of course. We had 11 weeks in moderate, of which 3 of those weeks had cases reported. There were a total of 3 cases, so 1 case per week. Or 1 case for each of those weeks, so less than 1. And then, it goes up. So then we had 6 weeks of substantial, 5 of those weeks had cases. There was a total of 7 cases for any orange weeks, and we had an average of 1.2 reported each week of that there were of each of those weeks. And then when we had a lot of weeks at high, and 18 of those had health notification letters. We had 56 cases reported during those high transmission periods, and an average of 2.5 cases in each per week. The range there was 0 to 6. And we had a few weeks where we didn't have any cases reported. I got curious about those dates, and they were hinging right around dates where we would have had holidays and maybe didn't need to report. So that's just something to keep in mind. And these aren't perfectly lined up. It depends on lags and things like that. So, but what this does say to me, one thing I could look at is the first, like the lowest rate that Littleton had a case reported was around 30 per 100,000. That was like the lowest rate. So that was when we were in the moderate level. We started having cases routinely reported when our rates were 60 per 100,000, and that substantial community spread, like essentially right where we are right now. And I do want you all to keep in mind that this was during the hybrid and remote period. A lot of this data comes from that, and that might impact what was reported, who was in the building, those kind of things. I don't remember the policies. So there's some limitations to this data, but I have to say when I restricted it only to the weeks where we were back 5 days full time, that the pattern was very similar. So it didn't change the interpretation. And so I see this as two high level takeaways for this very crude cross-examination, if you will. As a community, as our community transmissions rise, we will more likely, those are the weeks that we're going to see cases appear in our school community, like everyone, to be reported. And then most importantly, what this data tells me is that we can successfully and we have safely held in-person school without an in-person school transmission event when we had a layered mitigation strategy. So for me, this is like we had so many weeks at high and we still had in-person school successfully without a transmission event. So that's amazing. So I want to pat everyone on the back right now for that one. All right, so let's talk about that layered
One
mitigation.
question there, just the clarification. So those weeks at high, is it safe to say that those were weeks when we were in the cohort models?
Most of them, some of them came after we were 5 days still.
Okay.
So we were still high in the 5 days. I can't remember the exact number of weeks, but yes, over November, end of November, December, January, into February, we were still high. And then we had a little bump back up at the end of March, right about when we went to back 5 days and just after. And so we had some high transmission rates when we were in 5 day mode.
Great. Thank you.
Okay, so we're back to the cheese. I'm in the what do COVID experts say used for mitigation section of the presentation. So our COVID experts and ventilation experts recommend 5 main tools to be used in combination to limit transmission in any indoor setting, but that includes schools. The first one is vaccinations. I'm going to keep saying this over and over tonight. The key public health improvement we can make is to vaccinate every eligible individual age 12 plus. That's number one. The second one is ventilation. COVID spreads through the air. Whether droplets, aerosols, it hangs in the air, and it can, if not correctly ventilated, it can concentrate in the air. So making changes that one of the key prevention strategies is to make changes to move more outdoor air in, like improving those HVAC filters, using the HEPA ventilation filtrations to clean the air, opening windows, being outdoors. You guys did a lot of this last year, and I do think this is a great thing. So doing it again is really key. So the other one is masks, and I'll get into this in the next slide, but this is one we need to talk about. And then there's the testing. So testing is a reactionary tool. It's not preventative. It's trying to catch things quicker before they spread. So having a testing program in our school would really help to quickly identify people who may be contagious and may spread, and try to isolate them before they have a chance to spread, or to limit the spread among certain groups. The prevention benefits are higher when there is higher participation in testing programs. And again, part of this testing is sick policies are key. If you have symptoms, going to get tested, or staying home until you figure out what you have. So keeping the sick people out of the school where we share air is important, for flu, for RSV, for colds, and COVID. It's all the same. And then if we have a good testing program going on, we can use this data, especially if it's robust and a lot of people are in it, to evaluate our mitigation strategies and see where we might be able to loosen something a little bit to gain some whatever, and then needing to tighten down a little bit. So this is a key piece of data that we can use for decision making. And then the other thing that's recommended is to avoid indoor crowding. So as the community incidence increases, so does the chance that someone is sick in the group and in this shared space. So extra mitigation specifically should be planned for lunches or times when people are unmasked, clubs, extracurricular activities, sports, and any large group gathering. And as we saw in the prior slide, as our community rates rose, so did the number of cases in our school community in those health notification letters. And one of our keys to success was keeping our rates down as much as we can. That would help prevent cases from even arising in the school population in the first place, and that fewer disturbances for quarantines, close contacts, having to be out of school because you're sick, things like that would be good. It is important to note that none of these layers of cheese is perfect. And when they're used together, the benefit is higher. And I think last year really proved none of these are new to us either. We used all of these last year. So I think it proved that we can successfully hold in-school mitigation when we're using a layered mitigation strategy. And I think this is just reinforcing what we already knew from our lived experience. And I'll take on the elephant in the room, be the first one to do it. I know this is controversial. I hate talking about this right now. And I know I don't even like wearing a mask, but I think there's value in wearing one. Is there one definitive study? Nope, there's not. There's a lot of studies that point in the same direction, both laboratory and clinical studies that help indicate that masks help slow spread. The data on masks indicate that consistent and correct mask use is important to indoor and crowded settings. Masks provide source control. That means that someone who has COVID, flu, RSV, colds, their virus-laden droplets get caught in the interweaves of that mask and then therefore are not put into the air that you're sharing with other people. And masks also then filter back to you. So if there is virus in the air, your mask then and you're breathing through a mask, you're then filtering the number of virus particles that end up in your nose and your mouth. And it's actually the combination of these two, so the source control and the filtration, that is important. It's not just one or the other. That's the key for prevention. And studies have shown that the community benefits, or like the benefits of having more people wear masks in a shared setting, actually increases the efficacy of using them. You kind of saw that in the R numbers that I showed at the beginning. When more people have masks, our RE goes down further. So I know in June, there was this one JAMA article that was published that it wasn't even an article. It was a research letter that was published that said that masks don't work. And it was splashed all over the media. It was everywhere. And I have to tell you that that letter has been retracted. And the retraction did not get the same attention. So be careful of what you're reading and make sure that it's not retracted. And then to summarize in general, both the CDC's website, this PNAS article that I have snapshot of here, there's so many articles out there that are available to read. But to summarize, the preponderance of evidence about masks indicate that wearing a mask reduces transmissibility per contact by reducing transmission of infected respiratory particles in both laboratory and clinical settings. So the preponderance of science evidence is pointing to they help. Okay. I know this has got a lot of people worried, is that Delta's here. Delta is impacting more kids. And what do we know about Delta and kids? So let's just, what we know about COVID and kids is changing. And most of the data that we have about kids was collected in times when kids, their behavior, they were restricted. They were well restricted, whether schools weren't the same, they weren't socializing the same, they were wearing masks. To date, most of that data is not robust. There's evidence in there that they have less risk, like maybe less risk than adults, but less risk of severe disease than adults. But I think our current evidence is showing us that they can get infected at similar rates as other people. So if you think about our state data by age group, the 0 to 19 age groups have higher rates right now than their parents. So that's changing. And so Delta is more infectious. And it's clearly spreading among kids. I'm sure many people heard that this week, 94,000 kids were in the US were infected with COVID, which was up from 72,000 last week and 39,000 the week before that. So we are having a trend where kids are getting infected at a much faster rate than they have at any other point in this pandemic. And unfortunately, we don't have the data we need to really be definitive about that yet. And then thankfully, to date, the number of kids who have been hospitalized is low. Looking at the COVID-net data on hospitalizations, they've summarized 3,353 pediatric cases who are hospitalized compared to almost 190,000 adults. So it's really nice that that number is low.
It's not, you said it's through June, which doesn't capture the last 5 or 6 weeks. But when does that begin? Does that begin at the beginning?
Begins at the beginning.
The beginning of all of this, or beginning of the calendar year?
Pandemic.
Okay, thank you. All right.
Yeah. So this is from the beginning. So this image you're seeing here is the from the COVID-net, their underlying medical conditions. That data takes longer to come in. So that data is current through June, end of June. And I think it's really important to note that we keep hearing that kids with risk factors have a higher risk of hospitalization and more severe outcomes. But when we look at this data, it's nearly half had actually no underlying medical condition that could be documented. So that's concerning to me. And I'm glad that the absolute rate of kids who get hospitalized is low, but what that tells me is that we don't know who to shield. We don't know who to put a mask on. We don't know who to keep out of schools, because we don't really know who is more likely to get COVID, severe COVID reactions, even among kids. I think we're going to learn very quickly over the next few weeks, but we don't know yet. And then, and as more infections are happening, we're going to get more serious outcomes. We're going to hear more. We're already hearing of more hospitalizations and pediatric units filling up and things like that. So we're not seeing that in Massachusetts. Right now, we're okay. So let's hope we can keep it that way by limiting spread among all age groups, not just kids, but everyone. And the other thing I want everyone to keep in mind is that I can't think of an infectious disease that is not known to cause a long-term or late developing chronic disease. You got hepatitis and liver cancer, you've got HPV and cervical cancer. And there's a whole bunch of stuff that infections change our organs and our way our body functions. And there's some evidence right now that's coming out that COVID appears to get into our endothelial cells. And those are the cells that line your blood vessels, which explains why we're seeing clots and strokes and bleeding things happening, kidney bleeding, things like that happening with people who have severe COVID complications. And so biologically plausible is that there could be multi-organ involvement with any COVID infection. So to me, this means unfortunately, there's just not enough time has passed even in adults to have data that goes out long enough to actually quantify this. So we're still too early in this pandemic to really understand what the long-term impacts are from these infections. So I know personally as a parent, I'm separating myself now. As a parent, I don't want to dismiss this potential for a long-term or delayed health impact that may impact my children when they're my age or before they are my age, something that could really impact their life before they get a chance to be vaccinated. And we have tools to slow that spread and help protect our kids as they are also getting important education opportunity. So there's a balance. And I'm going to end here. So just as I said, we have the tools we need to prevent spread of COVID and other respiratory diseases in our schools this year. We did it successfully last year. We layered up. We didn't have an in-school transmission event, and we can do it again. I know we can. Doing so prevents disruptions from kids being out, then missing lessons, from teachers being out and we need subs, and helps keep parents at work. So it just all around, we're going to have a much calmer experience if we can just do a few things to help prevent spread as much as we can. And I'm really hoping that as part of everyone's back to school checklists, if you or your eligible child have not yet been vaccinated, please consider talking to your doctor and going to get vaccinated before school starts so that you have that partial vaccination status before the first day of school. talk to your doctor about any concerns you have. They can talk to you about your individual questions and situation if you have concerns. And then I noticed just today, the CDC updated its guidelines and now recommends vaccination for women who are pregnant and breastfeeding. This is a big development. So those vaccines are safe and effective, and also a pregnant woman can confer some immunity to their newborn when they're born. So this is an important step because that 0 to 4 has had more hospitalizations than the 5 to 9 age group. So that's important. So please talk to your OB or your doctor for more information about that. And then this vaccination is our best layer of defense. This is eventually how we're going to get out of this. So please consider getting vaccinated if you have not. And so let's do everything we can to set these students and teachers up to have a really successful year together in the building.
Thanks so much, Katrina. As always, very informative. Any comments from other board members?
Katrina, quick, thanks so much for that. It was really helpful. You closed with vaccinations, how we're going to get out of this. What does that look like to you, getting out of this? Like, we talked a lot about cases, and we touched on severity of cases a little bit. I'm just not sure that we're ever going to get to 0. I don't think the goal is to get to 0. So when you
I think we're getting to 0.
When you say get out of this, what does that look like to you?
So I think COVID will be with us. I think COVID will be, after a few more ups and downs in the road, is going to end up being a seasonal disease, much like flu, that we end up dealing with. And we'll end up with boosters, and we'll have other things that we're doing to prevent severe disease. These vaccines are great at preventing severe disease. So we know this is we're getting there. Their vaccines are doing what we asked of them. We don't know enough about kids right now for me to say, just let it go. Who cares? Let it go. Like, we don't need to do anything. We can just put them in school and they'll just get natural immunity and go. We don't know enough about the long-term or even short-term health effects of these viruses on young kids. We don't have the data. It's still coming in. So I am not comfortable just saying it's fine. We can stop now. I do think we're looking at vaccinations for hopefully the under 12 set sometime in the beginning of next year is the current timeline. And that would be a point where everyone who wants to get vaccinated can protect their child from the severe outcomes of COVID. And then I think the discussion will change again.
All right. So along those same lines, we have, I think it was 10%. What was it? 10% of the population that's not eligible, something like that. 13 not eligible. So when that 13% becomes eligible, if they choose to vaccinate at the same rate that sort of everyone else is vaccinating at, does that really put us in a much better situation? I mean, kids really, I'm asking the question, is this spreading in Middlesex County through children? Or is it spreading through the 20, 30 something percent that aren't vaccinated?
So being unvaccinated, whether by choice or by your age eligibility, is at higher risk for spread. And we have heard from the Board of Health meetings that more kids are testing positive. So more kids are getting COVID than they have seen previously. So locally, kids are getting COVID. I don't know. I can't tell you more than that until we get back to a Board of Health meeting to really grill Jim Gruffy.
Katrina, can I ask a follow-up question? Justin, I'm sorry to intrude. I can't remember where I've read anything these days. Right?
I have that problem too.
Yeah. So is there, part of, because I guess the follow-up on Justin's question, is there any evidence about not only the number of kids who are unvaccinated, especially getting it, is there any evidence that children are more or less likely or just as likely to spread it?
So when people said kids were less likely to spread it, all that data was against the original strain and alpha. And also when kids were very well restricted and their exposure opportunity was lower than adults. And so those two things are conflated. And I don't know if we can ever tease that apart. And given that Delta increases the viral load of anyone who's infected, I think kids are now actually, I've seen evidence that kids are having more symptomatic disease now than they had before. So I do think we're seeing evidence that kids can spread just as rapidly as adults. I don't know if it's that 5 to 9. It might be closer to 5, like on the lower end of the scale, if I'm being hopeful. But I don't have that number for you. And I do think part of exposure depends on the size of the group you're in and how you're, so if you're in a classroom and this thing spreads 5 to 9, if you're in a classroom of 20, that's pretty quick to go through a classroom if you don't have mitigation to slow that down. So I think once schools started for much of the US this week, unfortunately, in highly unvaccinated areas, we're about to see what happens with kids and COVID in schools.
Oh, we're seeing in my hometown, I think they have 1,152 people is the last number I saw quarantined or cases in the first week. It's not good. But that's Tennessee, and they're not dealing with 72% vaccinated.
Yeah, I mean,
very different community, but the school age population, it's running through those schools.
And remember that your schools, your 4 schools look very different in vaccination status. Like you have a high school that has, I think it was 74% of students in that age group vaccinated. You have a middle school where the 7th and 8th graders are at 76% vaccinated, but your 12-year-olds, your rising 6th graders are largely not eligible for vaccines yet, and they will become back eligible as the year goes on. And then you have Russell Street and Shaker Lane are just out of luck. They have no vaccine immunity among students because they're just not eligible yet. So you have 3 different scenarios you probably have to problem solve for. And that may, and where we're starting the year may not be where we end the year. I'm hopeful that there'll be room for changes, both good and more strict if we need it, but I'm hoping loosening as time goes on and more people get vaccinated, and hopefully, I don't think we're going to have the worst case scenario, but if we don't take care, we could have the worst case scenario, especially in those youngest age groups of schools.
Any other comment from board members?
One more question, because it relates. I'm thinking about mask in combination with other mitigation strategies. Distancing. That's the question, right? So as we're thinking about, for me, and I'll just put my cards out there, I think that I would prioritize having the students be with each other, be close to each other, be able to, communicate more clearly with each other, even if it's through a mask, over extreme distancing and the cohorting and the podding and that kind of stuff. Can you talk to us? Do you have any information at all about, I think we found that there wasn't a significant difference in our experience, at least with the other things in place, between 6 feet and 3 feet. There was no meaningful difference in our experience as we went through it, when masked, with everything else going on.
Given that we had pool testing during that time period where we went from 6 feet to 3 feet, and we had no positive cases pull up in that pool testing, that was fantastic. So that gave us real evidence that we could reduce that distance with masks successfully and still have everyone in those classrooms. And we know in classrooms, people are moving around. They're not going to be always perfectly 6 feet. I mean, goodness, a 4th grader is never going to do that. I know from experience. So I personally don't think distance is plausible as we add the full remote students back in. And after a summer of not having many restrictions at all, they're not gonna distance. You can see it when they're playing in yards and things. That's gone. And the studies for schools that pushed for 3 feet to get more kids in the buildings were all masked, universal masking. So, and then this is a question I am very curious about, is what I would love to hear is from our educators, which of these COVID mitigations are most problematic for their teaching and they're the kids' socialization, social emotional health, all those things. Which of these are like the most restrictive and problematic for our educators? Because I think there might be ways we can problem solve in certain settings. Like if this mask is making a phonics lesson difficult, can we take the lesson outside and take masks off? Or like there are ways we can problem solve here, but we need to know what the educators need us to prioritize in order to problem solve it. Do you know what I mean? So that's a great question for the school and the teachers and the administration.
Thank you.
And I think, Brad, we're going back 100% capacity. There's no remote option, so distance is not something really on the table at this point. The only mitigation strategies we're going to be talking about tonight are masks, continued pool testing.
Well, so I guess to my point is that we're going to be, my sense is that we'll continue doing other things that seemed significant this time last year. We'll have the best filters possible. We'll have the windows open. We'll have the additional units in. We'll do emphasize hand cleaning. We'll have outdoor whenever we can. We'll do all the 7 or 8 things that we initiated last year. So then the question is what's on the table and what's important for us to kind of deploy from the things that are on the table. And distancing, because of, for every, social emotional reasons, educational reasons, state law, is if that's not on the table, then it seems like the pool testing, which again, I'll just say if the state's paying for it, I'm definitely be in favor of us continuing to give our staff and students the option of doing that. It really does come down then to what are we doing about masking and what level are we doing? Because it seems to me that there should be, I hope there is consensus on all these other things. We're not going to say, let's get worse filters. Big marks, save the money.
We're a good place with the filters and all of that was put in place last fall. Kelly's going to talk a little bit more about the pool testing in a little bit. I think there's definitely some advances that'll make it even easier for us if we want to continue with it. And Kelly will touch on those in a few minutes. But for now, are we good with Katrina? I know that she's given us a lot of her time. And again, we appreciate the update, Katrina. I don't know. And we're going to hold off on public input until after Kelly presents. So Kelly, I know you were going to give some updates on what the recommendations are, what we're seeing from DESE, from CDC, all the different acronyms that you can.
Sure. I'll try not to use too many acronyms. First of all, thank you, Katrina, for presenting this evening. Information to be very helpful. And Steve, could you put the presentation up, please? Thank you. Second slide. So we felt it would be helpful to do a summary of the recommendations we've had from various agencies over the past 3 weeks. They have a tendency to kind of mix together if we don't separate them. So I thought that would be helpful prior to us having a discussion this evening in terms of what are we going to do in terms of mitigation strategies for the beginning of the school year. The American Academy of Pediatrics, Katrina touched on this, July 19th, they made a formal recommendation. Center for Disease Control and Prevention had a couple of updates. The latest update was on July 27th, 2021. Our United States Secretary of Education, Miguel Cardona, also made a statement on July 27th, 2021. And the Department of Elementary and Secondary Education, along with the Department of Public Health in Massachusetts, on July 30th, released a document with recommendations as well. The next slide, please. As Katrina pointed out, the American Academy of Pediatrics feels that we should have universal vaccination, or sorry, universal mask wearing in all of our schools when they're indoors. And they do put in their age 2 and up, which really doesn't affect us in our school system. Next slide, please. Guidance from the CDC recommends universal mask wearing in our schools, irregardless of vaccination. And on this slide, if you look on the right-hand side, they list 4 data points that they recommend we consider when we're making decisions throughout the year in terms of what mitigation strategies we implement in our schools. Community transmission is a data point that we've talked about this evening, an important data point. Vaccination rates, testing, pool testing, and also other forms of testing, diagnostic testing, and COVID-19 infection rates. So those will give us good data points to look at throughout the year. I'm not convinced that we're not going to have many conversations during the year based on data points, and I would imagine that we're going to be having to pivot in terms of our mitigation strategies depending on the decision that we make tonight. And even if we start the year with most of the mitigation strategies, there may come a time throughout the year that we sit down together and decide to decrease some of these strategies depending on those 4 data points. The CDC does recommend that when possible, we maintain at least 3 feet of physical distance between students within classrooms. And again, as I already said, indoor mask wearing for students and staff, irregardless of whether they're vaccinated or not. They also recommend that pool testing continue, ventilation, hand washing, and respiratory etiquette, staying home when sick, and getting tested. Contact tracing should also continue in combination with quarantine and isolation. Continuation of cleaning and disinfection mitigation strategies are also important layers of prevention to keep our students safe and staff safe. Students and teachers and staff should stay home if they have any signs of any infection illness, not just necessarily COVID-19 symptoms, and they should either refer themselves to their healthcare provider or our healthcare nurses can certainly recommend that as well. As we've talked about this evening, pre-K to 6 students are not eligible for vaccination at this point in time, and we'll spend, I'm sure, plenty of time talking about that this evening as well. What has been consistent throughout these recommendations is if people have pre-existing health conditions that or are immunocompromised, even if they are vaccinated, they should be masking. And if they have people at home in their immediate family, they should also be masking if those people are immunocompromised. The interesting note here, and Katrina did touch on this too, the introduction of transmission rates. We spoke about moderate and high community transmission rates or levels this evening. That is something that I feel is very important as we work through what we're going to do throughout the year. I like the fact that they're using consistent terminology and also color coding as well. I think that's the best way to determine where we are as a community. And I'm also going to make a statement that just focusing on Littleton is not enough. We're not a microcosm. We're not in a bubble. And we all know that people travel to many different parts of the state or beyond for their work. I'm not sure whether one analysis of a county, Middlesex County, is sufficient because we're surrounded by other counties with towns very close to us as well. So I'm sure Katrina will have some ideas as we move forward in terms of how do we look at a broad enough area to get a good idea of what's happening in that area that will affect what's happening in our community. Next slide, please. The United States U.S. Secretary of Education, Miguel Cardona, explicitly stated that he recommends that students and staff and visitors, when they're in schools, be masked. So he's a proponent of universal masking. Next slide, please. Guidance from DESE and DPH that was released on July 30th. DESE and DPH strongly recommend that all students in kindergarten through grade 6 wear masks when indoors, except students who cannot do so due to medical conditions or behavioral needs. Masks are not necessary outdoors and may be removed while eating indoors. They also strongly recommend that unvaccinated staff in all grades, unvaccinated students in grades 7 and above, and unvaccinated visitors wear masks indoors in alignment with the statewide advisory on masking. DESE and DPH kind of veered off the other recommendations that we've seen so far. And they recommend that schools allow vaccinated students and staff to remain unmasked. And again, I've already talked about this. If you're at a higher risk for contracting COVID-19 or a house member is at a higher risk, they recommend that individuals wear masks regardless of whether they're vaccinated or not. By federal public health order, all students and staff are required to wear masks on school buses at this time. And all staff and students must wear masks while in school health offices. The next slide, please. Thank you. COVID-19 testing, they're recommending, we are highly encouraged to maintain or establish a robust plan for COVID-19 testing, inclusive of diagnostic testing and pooled testing. As Brad pointed out earlier this evening, I think it's a tremendous plus that the state is going to be paying for these services. Our nurses have been trained in administering Binax Now, and Binax Now will become used a lot more than it was last year in schools as I start talking about the last section, quarantine protocols. We still are waiting for the final document for quarantine and isolation protocols, but we have been told as part of the guidance that's coming out, if a district employs pool testing and uses diagnostic testing, they're going to be able to implement a new test and stay protocol in lieu of requiring asymptomatic close contacts to quarantine. Under test and stay, asymptomatic close contacts will have the option to remain in school and be tested daily with Binax Now for at least 5 days. Vaccinated staff and students are exempt from quarantine. Again, that caveat is if we employ pooled testing and diagnostic testing in our school district. Something that isn't on the slides that came out yesterday, Massachusetts Association of School Committees, the acronym MASC. All of these school committees in the state of Massachusetts belong to this organization. They sent a memo out yesterday to superintendents and school committee members recommending that they adopt a universal masking policy. All of our school committee members were provided with that information yesterday. They also go one step further and recommend that we consider masking outdoors if we cannot maintain sufficient distances between students. The last slide just gives you links to the documents that I've talked about in the presentation. Thanks, Matt.
Thanks, Kelly. I guess a couple of, so pool testing, I wanted to touch on that real quick. So what do we need to do to continue on with the pool testing?
Well, we have to fill out a few forms, indicate to the state that we're interested in pool testing. I was going to touch on the differences that or options that we have this year that we didn't have last year. I mean, obviously, we could continue to do pool testing the way we did last year, but this year they've added another component to it. And there's two possibilities here. The lab will keep the individual vials from students for that week when they're pool testing. If we had a positive pool, they would retest those vials. And so it would be student specific, and they would be processing that information to us so we would know if we had a positive pool, who was positive in that pool. There's another option as well that when we do pool testing, they also do a saliva test at the same time. They would keep the saliva test for a week. And if we had a positive pool, they would use that saliva test that's labeled per individual in each pool to determine who was positive in that pool. So a great improvement in my opinion. That will certainly speed up the process. And personally, I would rather have the lab be testing rather than doing Binax now tests internally. I think that would be a plus, having the experts that test every day of the week do that for us. And that's at no additional cost as well.
Okay, so we could take a vote on that tonight, whether we want to continue with the pool testing?
Yes, you can. You bet.
Okay. I guess before we get into the public comment, just to kind of talking about masks, what we're talking about, we can put in a blanket universal mask policy for all students. We could look at what DESE and DPW is, I'm sorry, DPH, Department of Public Health is recommending that, was that who recommended that we do unmasked? It was DESE and who else?
It was DESE and Department of Health.
Yeah, Department, okay. So we can look at that option where we have vaccinated students with the option of wearing a mask or going maskless, or I think there's always if we want to go with the road of complete unmasking, I guess that would be another option. I don't know if that's the wisest thing to do, but
Matt, I wouldn't say masking. I'd say making it optional for everybody, not complete unmasking. I don't know if that's the right way to represent it.
Right. Make it optional for all grades would be the third option.
And Matt, can I ask a clarifying question? You're saying students, but we're also talking about staff as well?
Yeah.
Is that a separate conversation?
We're talking about staff as well.
Okay, thank you.
So they would be included in the vaccinated population. If they're vaccinated, they would have the option of wearing a mask or not wearing a mask. Okay, so I'm just being clear. Now, Kelly, one more thing. Say we know who a child 12 and under, I'm sorry, 11 and under has not been eligible for the vaccination. Child who turns 12, given if they got it on the day they turned 12 of vaccination, still take 5 weeks for them to be considered fully vaccinated, given the 3 weeks for the second Pfizer shot and then 2 weeks after that. Do we have any way of checking this for students or enforcing it? A student shows up without a mask on. What's the scenario there?
Are you talking specifically about grade 6 or are you going beyond that?
I'm going just in general right now.
Okay, well, I can start with grade 6 because that will be, depending on the decision we make tonight, there's a possibility that we would be dealing with that. The legal brief that I sent out certainly did indicate, and remember, it's opinion, it's not case law at this point in time, but they feel that we can ask for proof of vaccination as long as we keep that information confidential. If I apply that to, I guess, a broader discussion about the district as a whole, I think the first thing we have to ask ourselves is, are we going to have a cup half full attitude or a cup half empty attitude? And what I mean by that is our community, in my opinion, has been very, very good and very supportive of everything that we've done and have come forward and given us all the information we need to keep our staff and students and community safe. So having said that, we could take another approach and I'm not sure whether we want to do that, but according to the legal brief and the opinions expressed in that brief, we could ask for proof of vaccination.
Okay.
Students and staff.
Okay, that's helpful. Before we start on a discussion among the school committee members, I'd like to open it up to public input.
Okay. We do have 2 questions. Matthew Ridge, please state your name, your street, and your question, please. Matthew? Yep, there he is.
Maybe he'll come back.
Matthew, you're muted.
Hello, can you hear me?
Yes, thank you.
All right, good. Sorry. All right. 325 Great Road, Matthew Ridge. Several things, and this is just me, just because I've been doing the reading. I've been reading as well and everything else. I have an issue where we're just talking about the kids and everybody pretty much saying that they need to be masked, they don't need to be masked. It's an opinion. We've been going an entire summer without masks. And I know what you're going to say, it's not the same as it is in school, but one of my things is that we have been in even closer proximity in many cases to people whom may or may not have had COVID at the everywhere. I mean, if you go to the mall, if you go to the supermarket, if you go to anywhere, there is no way you're 3 feet apart. I mean, and especially with the younger children, they're going to be forced to mask up, even because they can't be vaccinated. It's not that they don't want to be, it's they can't be vaccinated. The children themselves, at the younger ages, kindergarten, preschool, first grade, all the way up to, what is it, third? Anyways, you're talking about pretty much barring an entire subsect of our children to continuously wear masks. And that's when you're also talking about the most vulnerable when it comes to education. I can tell you right now, my son himself has had issues this summer because he was not able to see his teacher's face. Social interactions, speaking, and things of the sort. He is, I'm not going to say developmentally negative. He's not negatively impacted entirely, but he is saying words incorrectly because of whatever reason. And these are words that he learned while he was in school. We need to come up. We need to just not worry about the kids who can be vaccinated. We need to worry about the kids who can't be vaccinated, because, as you said yourself, the Delta variant is prolific in its ability to spread. Our largest impact was down in P-Town. There's been over 1,000 people so far that they found with the infection. And as of date, there's only been less than 1% that was actually hospitalized. The majority, they said, were actually with secondary issues. And in the United States themselves, they have said that the entire COVID pandemic, or the COVID variant, has affected 0.00008, or has hospitalized 0.0008 of everybody inside the United States. Now, I know that seems like, okay, well, that's the United States, that's not Massachusetts, but we shouldn't jump to worst case scenarios either. We need to make sure that we're doing everything in our power to make things as normal as possible. And I think going to the worst case scenario first is the worst case, what we can actually do. We need to, like you said, next week we should find out how we're going, but we shouldn't just say that because P-Town got hit, flags are up, I surrender, let's go back to the way we were. I mean, you guys can say that you guys can even vote saying that anybody who's been vaccinated, masks aren't mandatory, they're optional. What about the children? And I hate to put it that way, but some of the children will never be vaccinated until they're much older or until next year. Is it fair to them? Because none of them have had, as you said, they may have been affected, but the one thing is that they have never shown infection under the age of 12. No documentation, at least that I have seen, has shown any child like from 9 to 4 has shown any infections, and any of those has had secondary or tertiary of issues, which means that they have been immunocompromised. And for me, that is what we have to look at, because our children, as far as I know, the majority of our children are healthy. I'm not saying that they should not wear a mask, but if people are afraid that their children are going to get vaccinated, let them wear a mask. Those who aren't afraid or who think that the child does not need to wear a mask, let them not wear one, because some of our children need, I'm not going to say breathe, but they need a little more freedom. Because if you've gone from 6 feet to 3 feet and you're still afraid, what happens if we get an outbreak in Massachusetts? What happens if we get an outbreak in Littleton? If we get one in Billerica, all of a sudden, are we going to start panicking because it's at our doorstep again? We need to worry about what we can control. And right now, we're never going to be at 0%. We're never going to be at 5%. We're never going to be at 3%. It's statistically impossible with the virus. And that's what we have to look at, is that where is it going to end? Where are we going to say we can live with this? Because I can't live with my son being miserable wearing a mask. When he comes home, he's sweating in it. He's sucking on it because he can't breathe on it, because he got to take the moisture out of it. Because that's where he's at. And during the summer, I can't imagine it's going to be any better when he gets to school. So we gotta look at those health issues, because if he's breathing in his own sweat, if he's breathing in whatever because he has allergies, if he's coughing and stuff like that from allergies, because the mask doesn't protect him from allergies, it's going to affect his breathing. So how are we going to work on that? How are we going to make this viable for people like that? Because right now, my son will be having a mask that is filled with sweat when he comes home. And that's just from day camp for only a few hours. I can't imagine what a school day is going to look like. I think I've said all I can. Thank you.
Thanks, Matthew. You definitely bring up some valid points, and I appreciate your input. Anyone else with their hands raised, Dorothy?
Yes. Jean, please state your full name and your question, please. Jean? Jean, are you there? All right, we'll move on to the next. Shelley Harvey, please state your name and your question, please.
Hi, good evening, everybody. Can you hear me?
Yes, your name, your street, and your question, please.
Sure. This is Shelley Harvey of 8 Birch Road. Sorry to add on to, the unpopular opinion here, but I was just listening to Matthew, and I really can't say enough about how much I agree with him. I think we've all done our part. We've taken COVID seriously. My whole family has been vaccinated, who can be vaccinated. We took part in the lockdowns. We did all the mitigation strategies. And it just really breaks my heart at this point that we're talking about making the children go to school masked. It's like he just said, they don't have the option of getting the vaccine. So I don't understand if teachers are vaccinated, staff is vaccinated, people in the households are vaccinated. Katrina showed our numbers are excellent. Why are we making our children wear masks? We are protected almost 100% from this virus if we have the vaccines. The children are not as affected by COVID. And it just doesn't make sense to me at this point to mask the children. And I don't think that I listened to Katrina very closely. I didn't hear anything about any definitive study about cloth masks being very effective to prevent COVID. I feel so bad for these poor little kindergartners wearing masks. They don't understand. They can't see people's expressions. I am very against a mask mandate for children. I think if you want to send your kid to school with a mask, they can go with a mask. But I'm very against mandating our kids to go to school with masks. I have a lot more I could say about it, but I think Matthew really covered a lot of how I feel about it. Thank you.
Alternate and A.
Thank you.
Thanks, Shelley. Do we have
We'll try
Jean?
Jean. Jean?
Can you hear me?
Yes. Thank you.
Oh, good. Okay, thank you. Thank you, honey. I tried before and it didn't work. Anyway.
Jean, could you give me your full name, your street, and your question, please?
Jean Cleary, 4 Old Orchard Lane. And I agree with the two prior folks. Where did common sense go? And I remember growing up, we had the virus protocol was, take vitamin C, get plenty of rest, D, stay away from people till you feel better. Whatever happened to that? Like, you did not take anything for a virus because a virus will work itself out. And what about the 99.9%, kids, won't even get it. And also, you recover, it's basically the flu, that's the reality. Now, I don't know, why everybody believes the CDC, because it's going to come out pretty soon. And it already has, if you're looking at any alternative media, that the CDC is corrupt, as is the WHO and many of these other people that you keep referring to as who we should be following. I don't know if anyone was able to see the 12 doctors that were on the Capitol steps back in March or April. Dr. Sherry Tenpenny, Dr. Carrie Madaj, you can look these ladies up, and many other immunologists and virologists and people that are very adept at their specialties. I can give you many. I've got many that I've been watching over these many months. So basically, what you people are believing is a bunch of lies. I don't want to be rude, but this is the truth. It will come out, and the vaccine, I know many people that have been harmed from this so-called vaccine. It's not a vaccine. It's a mRNA device that changes your DNA. It does all kinds of things to you. And it's really, really, really destructive. And we're going to be seeing that as soon as the first round of the flu hits in the fall. It's going to get pretty scary. And I have a family member that has taken it. I tried to stop her. My sister, my older sister, who is a doctor, and her daughter, who are doctors, will not take this thing. And my older sister, who's a doctor's good friend, who's a doctor, took it, and he ended up in the hospital near death on a ventilator. My dear friend has a friend who was pregnant. She took the vaccine, so-called vaccine. We should not call it a vaccine. It is not a vaccine, because vaccines are a total nother animal from what this thing is. This was an emergency use only thing. And anyway, so she had a miscarriage. And I've heard of many, many similar things where people have had miscarriages and blood clots and heart attacks and all kinds of stuff. And the mask thing, it's been debunked. That's just nonsense. Okay, I'll stop now. But I have plenty of proof. If anybody wants me to give them any of these things, you can look up. I would highly recommend looking up Dr. Sherry Tenpenny and Dr. Carrie Madej, Madeg. And also, there is another one that's very good. This is a chemical pathogen, folks. This is not even this is like emergency use only. But anyway, if anyone would like to contact me, I'm at Old Orchard Lane, and I've got all kinds of really good doctors and immunologists and virologists. My sister's a doctor and her daughter's a doctor, and they're not going to take this thing. And the masking is outrageous. Kids have gotten sick. They cry before they get on the bus, before they go to school. They come home, their faces are red and pimply, and you breathe. The mouth is the dirtiest place on the body, even more dirty than our privates. Okay, that's the reality. That's what one of these doctors makes very clear. And you want kids to breathe that in all day long? Okay, enough, folks. I've heard enough. That's my say.
Thank you, Jean.
Thanks, Jean. Who's next?
Diane Prunier, please state your name, your street, and your question, please.
Hi, can you hear me?
Yes.
Hi, it's Diane Prunier, 26 Boxborough Road. I have a kid a son who is going into transitional, and I'm not going to jump in on the whole mask debate because you guys have your work cut out for you. I personally will probably keep him masked. He's been masked indoors throughout the summer, and he's done just fine. He's been unmasked outside and done just fine as well. But my concern is really the social distancing piece, which I know you kind of touched upon and said it wasn't, but then, or that it wasn't going to be a part of the discussion, but then there was a piece that somebody had mentioned that I think one of the guidelines was to remain 3 feet. And my concern is just that he went through kindergarten last year, and we had despite everything, we had a great year, a pretty great year. It was some challenges, but I guess maybe a question for Michelle Kane is if we do, hopefully, well, whether or not you mask again, I'm going to kind of stay out of that one, but Adam will probably be masked. But regardless of that, I was wondering, can we bring back like group tables, carpet time, play areas and stuff? Because really it was so sad last year that they had to sit at desks and they each had their own toy bins and they couldn't share toys. And like I remember in preschool, I was able to go in and volunteer, and just to, you know, I'm fine with them, like I'm all for masking, as long as we can have like normalcy in the classroom as far as sitting closer together or, you know, interacting and playing, because these young kids, they really do need playtime and they need to interact. And yes, of course, we all want, like, I think nobody wants to mask their kids necessarily. I'm not saying, you know, I'm not saying that. We, in a perfect world, we would all love for our kids to just go back to school unmasked and just have it be that way. But that's kind of not the way it is in the state of the world right now. So of course, I don't want to mask him, but I'm probably going to. But regardless of that, I think I just want clarification on, can we bring that stuff back into the classroom? Can it be more colorful? Can there be no desks necessarily? Can there be tables? Can there be playtime with each other when they're interacting in the same sandbox in the class or whatever it might be? Because my heart would absolutely break if that is not the case. So I was just kind of asking for maybe this is, we're going to talk to find out about what the answer is, but I just kind of wanted to ask that question and pray that our kids can actually play together and have a dress up area or just interact with each other a little bit more. That would be wonderful. Thank you very much.
Thanks, Diane. Michelle or Kelly want to handle that?
Kelly, I can take that, but I assume maybe you'd want to start, but it's completely up to you.
I can start. Michelle, you can fill in the blanks. Mrs. Kane and I had a conversation about this today. And again, our intent is to bring as much normalcy back to the classroom as we can. The decisions we make here this evening are going to determine that. I would venture to guess if we're not masking, we would be a little more cautious. We would have to be. So it's important to all of us that we move forward as much as possible this year, and at the same time, and it will always be this way. Our students and staff are our top priority in keeping everybody safe.
Michelle?
Yeah, thanks, Dr. Clenchey. So Diane, we did talk about bringing the rugs back. I believe we are trying to stick with a 3-foot distance on the rugs. But at tables, you know, we are Dr. Clenchey and I did talk about allowing teachers to bring the tables back. We probably will have some dividers for some students that, would have a distance that may be less than 3 feet. So our 6 feet table, you can fit them 3 feet on each end, but across the width of the table isn't 6 feet. So we talked about setting dividers up there. We were talking about this at our admin meeting yesterday, and Mrs. Temple brought up a great point that, sometimes bringing back some of these other factors, such as masks and barriers, will allow for more of those normal looking classrooms that we have, the tables, the partnerships. The sharing of materials, I believe, is allowed. That was part of the, I believe May 25th, we had some guidance on that from the commissioner, the Department of Elementary and Secondary Education, that we can share materials, so they won't have their own individual toy boxes. So hopefully that answers most of your questions.
Okay. Katie W., please state your full name, your street, and your question, please.
Hi, can you hear me?
Yes.
Hi, I'm Katie Woodward, and I live at 11 Delaney Drive. I do not have any questions. I just wanted to comment that I agree with everything that Katrina said. I think that masks are very important. I think that masks are going to keep the schools open for the kids. And I think that the kids' social and emotional status should be a priority right now, because I'm actually more concerned about kids getting sick or perishing from self-harm than from COVID at this point. And that, therefore, I think the schools need to do as much as they can to try to stay open and keep everything open for the kids.
Thank you, Katie. John Kay, please state your full name, your street, and your question, please.
Yeah, it's John Kurzwick, 171 Hartwell Avenue. I can't believe we're here again talking about COVID. I thought this was going to be over. At least I thought we would be returning closer to normal. So anyways, one area that I think is a reasonable approach at this point is that it's my understanding both the CDC guidance, the DESI guidance, and the I forget what the third one was, of the American Pediatrics, their recommendations at this point, and to me, I think we should take a voluntary approach. If for some reason it turns into a mandate, so for instance, right now the governor does not have a mask mandate for the state. There's a mask advisory. If for some reason the situation changes such that it does turn into a mask mandate, then we come back and we say everybody in school has to wear a mask, or everybody that's not vaccinated has to, whatever the mandate ends up being. But right now it's a recommendation, and to me, there's a lot of progress that's been made, with the vaccines and just generally with the, overall herd immunity. I think people have touched on a lot of points that I had written in my letter, but I think it's worth reiterating. COVID, as it relates to young people, has a hospitalization rate that is at or below influenza. That's using the CDC's data. The mortality rate for COVID is 2 per million, which is way below drowning deaths, accidents, suicides. It's about 10 times lower. So I think from a safety standpoint, the kids, even the kids that are unvaccinated, they're at very low risk from just if they get the disease. Then you get into the question of, I know people have been talking about the mask and so forth. I wanted to add to the conversation on that just a bit. We all understand that there's this mechanistic theory behind the mask, which is if you're wearing the mask, it will reduce, the amount of droplets that come out of the mask. But there is now a recent study that just got published because somebody said, gee, I wonder how many particulates actually come off a mask that is laden with fungus, bacteria, sweat, and the virus. And so I think that was a very good scientific inquiry. And so what they did is they looked at the particulate counts that come off these masks. And guess what? It's like shaking a vacuum cleaner filter. If you shake that, you're essentially just shaking the dust that you just sucked up out of the air back into the air. And in fact, it acts like a nebulizer. So it actually makes smaller particulates. So, I understand that there's some science that says maybe it reduces, but I think my view of the situation is the masks are actually probably pro-infection. We've had studies that look, anytime they do a randomized controlled study on these things, they can never show a difference. And I think Ms. Hagberg said that she said that there was a 50% reduction. There is no way there's a 50% reduction with masks. I mean, that would have been apparent in any of the randomized clinical trials. The next point I do want to reiterate is one of the reasons behind the mask is that we said, oh, we don't know who's carrying the virus. So because of that, we have to mask everybody that's healthy, everybody that's not showing symptoms. Well, we already have the data. We have the data from JAMA that showed that, asymptomatic people in households, they had an 18% secondary contact attack rate versus asymptomatic was only 1%. And then our own school data shows when we swab every kid that doesn't have a symptom, it comes back negative. What this means is that generally speaking, there's a low propensity of people that have COVID in the school when they're not symptomatic. So the masks aren't really blocking people. And that's why I keep reiterating the number one thing that we should be doing as a school to keep the kids safe, keep the students safe, is make sure we keep the sick kids out of there. Because you're not going to block the virus. You're not going to block the virus with these masks. It's just not going to happen. And then I think the other thing I do want to say too is, the masks have downsides. I think we heard from a gentleman earlier that said something about, his kid had some problems with it. My own kid did have red eye basically the whole year. I mean, we were like, are you rubbing your eyes? What are you doing? What's going on? And as soon as school ended and he didn't have to wear the mask anymore, guess what? Red eye went away. So I think it's just, to me, the mask approach, I think it can be voluntary at this point. It's a recommendation. I understand it's a strong recommendation, but I would leave it at voluntary. I would implement the ventilation and all the stuff that you guys are talking about there. But on par, if somebody told me, gee, it's really risky, there's a lot of virus in the school, but go ahead, send your kid in with a mask, I'd say, no freaking way. I'm not going to rely on a mask to protect my kid. You kidding me? Would you send your grandmother into a nursing home if there was a outbreak of COVID and say, oh, grandma, just wear the mask, you'll be fine? No way. It's not helpful. In fact, I think it's spreading things. So anyways, that's my opinion. I would keep it voluntary. And again, if the situation changes and there's a mandate that comes down, okay, our hands are tied, a mandate comes down. Thank you.
Thanks, John.
Thank you, John. Ina Landsman, please state your name, your street, and your question, please.
Hi, Ina Landsman from 27 Lawrence Street. We're parents of an incoming kindergartner and a 7th grader, and we urge you to vote for our mandatory masking at least through the middle school. As you know, multiple expert organizations, including the American Academy of Pediatrics, or an organization of over 60,000 pediatricians, strongly recommends mandated masks in school. But they're not legally able to mandate masks in school, so they look to school committees like you to do the right thing. Just last week, my daughter had her five-year physical, and her pediatrician was clear that she thinks all kindergartners need to be in a mask in school. A voluntary approach will not keep the Delta virus from spreading within the schools. We look to you to keep our children safe and our schools open, and that means following the expert advice of our pediatricians. Thank you.
Thank you. Jamie Kennedy, please state your name, your question, and your street, please.
Hi, it's Jamie Kennedy at 50 Gilson Road. And I actually first want to say thank you to everybody who's working in the administration and on the school committee. I know you guys have a lot of data to look through in order to make your decision, but I do have 3 questions. My first question, I think, would go to Dr. Clenchey. I was wondering if you have stats you can share on the percentage of staff at each of the schools that did get vaccinated or are fully vaccinated, and whether or not we have plans for how we're going to deal with visitors to the school or substitutes to the school and their vaccination status. My second question is probably also for Dr. Clenchey, related to if things were to go bad, if we were to have very high infection rates in our area, what your plans are for mitigating that in the schools, either going back to remote or hybrid learning, and having plans for that in place. And third, since we don't have a remote option for parents who did that last year, that's not an option this year, if we were to not have masks and other mitigation strategies voted on today, what are the options for parents who do not feel safe sending their kids to school without those mitigations in place? Thank you.
Thanks, Jamie. All very good questions. I'll turn it over to Dr. Clenchey to answer those for you.
Thanks. Thank you, Jamie. Good questions. In terms of vaccination status, it wasn't until yesterday where we had a legal brief that, and again, I want to emphasize a legal brief is an opinion. It's not formulated from case law. So we do not have that information. Prior to that memo that we received the other day, we were not able to ask that kind of information, nor were we requested to ask that information. So we do not know what the vaccination rate is for staff. Infection rates, if they continue to increase, or if they did increase more correctly, at this point in time, the Department of Education has sole authority in determining what learning models that school districts use. So at this point in time, the only learning model that we can use is in-person learning. I would imagine, and again, that's not my decision, but if there was a need to reconsider hybrid learning and remote learning as a result of infection rates, I would hope that the Department of Education would entertain those different learning models to help everybody out. In terms of remote learning, we are not a remote learning entity. So there are remote learning entities out there that if that's what you decided to do, you could certainly pursue those avenues.
Kelly, can I follow up with 2 questions related to your answers there? The first is, if families do decide that they need to pursue a remote learning option, is that something they have to investigate on their own, or is there someone at the school who could help them figure out what the options are?
Well, we certainly have a list of remote learning schools that we could provide to them.
All right. And the second one relates to your first answer, where you said, you got the guidance yesterday that you think you can legally ask for this information, but you said something about, we haven't been asked to collect that information. Is that something that you would need the school committee to direct you to do, or is that something you can make? I'm sorry?
Yes, that would have to be a school committee decision. And I know we've heard a lot of information tonight. We all have to decide whether that is the best route to go at this point in time.
As far as asking the question about whether we can ask the teachers and staff their vaccination status. Is that
whether we want to do that? We've been given an indication from the legal brief that I sent out that would be possible. Before that legal brief came out, we could not do that. So now we have that option if we so choose.
Okay. Thank you.
Next question.
I think she asked all three at the same time. So moving on to Kelly Hart, right?
Okay, Kelly Hart, please state your name, your street, and your question, please.
Yeah, hi, my name's Kelly Hart. I live on 18 Hibiscus Lane in Air, and I'm a kindergarten teacher at Shaker Lane. And earlier this evening, Katrina mentioned that she would like to hear from some teachers about our experience, and listening to some parents talk about mask wearing. I wanted parents out there to know that last year I was also very nervous about how students, especially as young as 5, would do in masks. And I was very pleasantly surprised that from my class of 16 to 18 students, honestly, all of them did a wonderful job wearing masks. It became part of their clothing, part of their outfits. And there came a point when we were able to go outside and unmask, and many of them chose not to because they were so comfortable in their masks. And additionally, I know we had several parents tonight talking about the heat and how wet they get. And that is true. Those masks sometimes would get wet. But we do have a large supply of masks to give to students when their masks get wet. Either they're sent in by the parents, or I had quite actually a large supply donated by parents of just disposable child-sized masks that the children were able to quickly change out of. I just wanted to give you my very honest opinion of what my school year was like last year. And the kids do really, really well. And they were so happy to be there. This next year coming up, I know since we're lucky enough to welcome everyone back and more children have registered, our kindergarten class sizes are significantly larger than they have been in the past, recent past anyway. And with more children in our classroom, I think it's going to be even more important for us to all be wearing masks together and setting that example. So I just wanted everyone to know that your kids actually do great at school.
Thank you, Kelly.
Thank you.
Greg Tez, please state your name, your street, and your question, please.
Greg Tez, 117 Whitcomb Ave. And I have more of a statement. I want to first start off by thanking Kelly Hart. My son Brandon was in her class and he did great. Wore a mask the whole season, the whole year, and everything was great. I want to thank the school board, for really listening to Katrina, and I also thank Katrina for lending her expertise here. And I want to say I do have the sense that the school board, for the most part, has an open mind on this subject and has listened. I also appreciate the interest of the community and the willingness to research the topic. However, I just want to point out, right, expertise does matter. And, when we have, the National Association of Pediatrics and other organizations, DESE, Katrina, who's now, who's a trained epidemiologist, sifting through the literature, you have to listen to those opinions seriously. It's easy to find counter opinions, right? It's easy. We could find on any topic. And I kind of think of it like this. If, you go to the mechanic and the mechanic tells you there's a serious issue with your car, you don't look online to find, information that disproves the mechanic's thought. You maybe go to a second mechanic, a third mechanic, and you build a consensus opinion. And let's be clear, the overwhelming consensus is that masks work. There's no doubt about it. Personally, I'm in favor of masking, and I understand there's an issue of whether vaccinated or unvaccinated, where there should be a line drawn there. But what's clear is now the game has changed, right? And as Katrina mentioned, with Delta, everything we knew is different. And, some of the reports are that people are despite vaccination, are getting the Delta variant. And I don't think we should overlook that, because if we, if we have two choices, right? If we side on no masks, by the time we realize we have a problem, it's too late. If we are overly cautious, the worst outcome is we had kids wear masks for the full year. Overwhelmingly, the recommendation is that we continue to wear masks, and other school districts have already made that decision. I encourage, the school board to do the same. I'm in favor of masking at all levels. Just wanted to say that. Thank you.
Thanks,
Thanks,
Greg.
Greg. Jillian Shaw, please state your name, your street, and your question, please.
Hi there, this is Jillian Shaw, Sleigh Ride Lane. I'm going to piggy off a little bit from Greg's conversation that he just had, listening to that. And the point is, we have a lot of experts out there, and we have a lot of things that we can go to, but at the end of the day, we can have a discussion with our pediatrician, but it should be our ability as our parent to make a decision for our child. I would like to have the option come to the table of the ability to have masks optional. And a suggestion would be, if that was the case, would be maybe to then have them part of pool testing if they did not choose to wear a mask. I am a parent of an incoming 6th grader who's on that cusp of being able to be vaccinated. There are some concerns that I have, and I know that there are a lot of people with younger children who have concerns. And I will say that one of the major things that will impact my decision is if masks are mandatory. It doesn't sort of push me over that line to get them vaccinated. So if we are trying to get a higher rate of vaccination, the reality is, if you make an option masks to be optional, I think if you let that happen, I'd be more willing to vaccinate my child. And the last piece is, we had a conversation with our kids about the risks of the deaths from COVID and things like that. They have lots of questions, and it made us talk about their risks and the possibility of being in a car accident and what those rates are. And someone had made a comment about, well, we've introduced seatbelts, and it made me think about the school buses that we send our children to school on have seatbelts, but the reality is they don't use them. So I'll just leave you with that thought, and I appreciate all your hard work towards this.
Jillian.
Thank you, Jillian. Julie Baker, please state your name, your street, and your question, please. Julie Baker, you're muted.
Can you hear me now?
Yes, thank you.
Thank you. Sorry. Julie Baker, 210 Hartwell Ave. I'm the parent of 3 students in our schools, and they actually will all be attending 3 different schools next year. I'm also an educator in a nearby town and have lived through this in the school environment. I don't have a question, I just have a statement. I wanted to call in to encourage the committee to take a preventative approach if we want to have the best chance of keeping all students and staff in school as much as possible this year. After last year, I think I speak for many, none of us want to see another disruptive school year. It will be important to maintain as many layers of protection as possible, and with distancing almost non-existent in this new model, masks seem to be a fairly simple layer of protection to keep the virus from spreading in our community. There's one additional viewpoint I wanted to bring to your attention. Last year, many families, I think in the beginning of the year, it was roughly 1/3 of our families chose to keep our children remote, mine included. The reasons for this decision may have varied, but I want to say that decision, I am positively sure it was not an easy decision for any of those families to make. None of us wanted to keep our kids out of the schools. So the reasons may have varied per families, but many of them were made to protect more vulnerable family members, whether it was their own children or others in the household. My daughter is a rising 6th grader and is just one example of a student who is at greater risk of a serious illness if she contracts COVID. With that in mind, I'm really concerned about the equitable access to a safe education for all of our students. And I sincerely hope we can work together as a community to help protect one another, especially those that are not eligible for the vaccine or those that have underlying health conditions that make this virus potentially very dangerous. Thank you for your time.
Thanks, Julie.
Thank you, Julie. Ashley Jock. Oh. Ashley Jodka? Ashley Jodka, please state your name, your street, and your question.
Hi, I'm Ashley Jodka. I live on Harwood Avenue. So far, the callers tonight seem to be under the understanding that young children don't catch this and can't catch this. And I just wanted to say that's not true. Recently, we had a young child contract it. She did have symptoms. It's here in town, and we've been fairly safe throughout this whole adventure. My question is, what happens if you have a student who has to quarantine or get sick? We've learned that quarantine is really long, and sometimes it's not just the 10 days or the 14 days. It's making sure that no one else contracts it in the household, and then the other people have to quarantine afterwards. So we were in the house for 17 days, and I don't think people realize masks are so easy to put on your face and wear. Taking 3 weeks off of school isn't really a good option, and it is here, and young children are getting it. So that's my question is, do we have a plan for students that have to quarantine? Thank you.
Thank you,
Ashley. Thanks, Aaron. Kelly, Dr. Clenchey?
Thanks, Matt. We are still waiting for guidance from DESE in terms of quarantine protocols and isolation protocols. I did mention that in this case it wouldn't apply, but they were coming up with some new guidelines if you're vaccinated and if you're asymptomatic. But if you were symptomatic, we would continue to connect with the student and the family and provide educational services during that time.
Okay.
Thanks, Kelly.
Last question, I believe. Katie, please state your full name, your street, and your question, please.
Hi, my name is Katie Tlepsiak, and I live at 132 New Estate Road. And I just wanted to take a quick minute to say that we have seen a huge increase in kids this summer with standard upper respiratory infections. I work in primary care pediatrics. We're testing kids for COVID-19. Have I seen that many kids with COVID-19? I have not, but I've seen a bazillion kids that have runny nose, cough, nasal congestion, fevers. And so my fear, if we do not put all kids in masks this fall, is that classrooms are going to have runny nose, nasal congestion, and cough. Now, 3 years ago, did every kindergarten, first grade, second grade classroom have a runny nose, nasal congestion, and cough in September and October? Of course they did. And we sent our kids to school because they didn't have a fever and they had those symptoms a lot. I mean, I was a person who every single year of my entire childhood education, I had those symptoms a lot of the year, right? I had allergies. And so now with COVID-19, we're unable to differentiate. So anytime people get those symptoms, they're going to be going to their primary care. They're going to be having to be out of school until their symptoms resolve. And I just feel that if we keep masks on, that will be less likely. In this year in primary care, we did not see a lot of RSV, a normal respiratory virus that children get. We saw none of it in the winter. UMass had less than 10 admissions for RSV this winter. And this summer, I think I've had 10 kids in the last week in my small primary care practice who have tested positive for RSV. So not wearing masks has really made a difference in the things that are not COVID, but that may keep our kids out of school. And so I just want people to think about that this is not just about COVID-19. It's about what is the path to get our kids in school the most time in front of their teachers and playing the way we want them to play. So that's what's most important to me. And I just want people to be thinking about it. Thank you.
Thank you, Katie.
Thanks, Katie.
One more question. Christy Ellman, please state your name, your street, and your question, please.
Sure. My name's Christy Ellman. I'm at 64 Gristmill Road, and I apologize. I missed a little bit of tonight's meeting, and I just wanted to I know the CDC is recommending masks for kids that are, K through 12. My request is that for those children who are under 12 and do not have the option of vaccinating or not vaccinating based on whatever various parents may feel or what have you, that masks be mandated for any child under the age of 12, because obviously we've seen Delta's gone bananas. All the maps show you that over the last 4 weeks. And we're still several weeks out of school, so we can just assume that'll be worse. So it is my hope and request that it is a mandate, not an option for children under the age of 12, because certainly if it's optional, we all know that they're just not going to wear them if someone else is not wearing them, because we're all mentally done with masks, but they do work, to several people's points. So my request is just, again, for children who do not have the option to make a choice, that it is mandated in the schools for anyone 12 and under. Thank you.
Thanks, Christy.
No more questions, Chairman Hunt?
Okay, so that concludes our public comment section. I'd like to hear from the board now. I kind of like to break this down into at least 3 areas. One, I think we should deal with the softball first, which is pool testing. I'd like to hear input on that. Then I'd like to follow that up with staff in grades 7 through 12 who are eligible for vaccination, and then we can deal with K to 6 students. That's how I'd like to see it go, but that's just my suggestion. Okay, any board members want to chime in on pool testing? They leave?
We're here.
Okay.
Jen has her hand up. Timlin has her hand.
The 3 of us have our hands up.
We all have our hands up, Matt.
Yeah.
Oh, I can't. I gotta switch my view then. Okay.
Oh, no, we're here.
Okay. Jen, go for it.
All right. Briefly, I'm for pool testing. I think that the schools did a great job last year. I think there's only good to come from data. I think the more data we have, the better. Anecdotally, my kids both did pool testing. It was a no-brainer, not a big deal, easy. The administrators and educators, teachers handled it really well. And I would be all for pool testing unless there's some financial or other reason why we shouldn't continue to do it. But the more data, the better. And I'd like to continue keeping our finger on the pulse of what's going on.
Any other board members want to chime in before we take a motion? I think this is a no-brainer for us. I mean, it's always good to, as Jen stated, it's always good to have more data. So at this time, I'll accept a motion on the pool testing.
I move to continue pool testing in all the schools.
Second.
Motion made and seconded. This is a roll call vote. I'll start with Timlin.
Timlin Rassius, yes.
Justin?
Justin McCarthy, yes.
Jen?
Jen Gold, yes.
Brad?
Brad Austin, yes.
And Matt Hunt votes yes as well. Okay, now we'll open up to the mask mandates. Again, my suggestion is we break it into the 2 groups, but if you can discuss both at the same time. So any comments from school board?
Did you want to talk? Did you want to ask about? Should we direct administration to inquire about teacher staff vaccination status, or?
I think that would depend on how the vote goes.
Okay, sorry, I misunderstood you earlier. I'm sorry.
Yeah. So any comments on masking at this time? Justin, you have your hand up?
Yeah, sure. I think we probably all have a lot to say, but even before, I had a question about one of Kelly's slides. If you wouldn't mind just addressing this. So it was one of your last slides where it was the test and stay portion slide, which I understand, but it said something about exempt from quarantine if vaccinated. Does that essentially mean that if you're a vaccinated individual and you're identified as a close contact, that you don't need to quarantine?
Yeah, thanks for asking that, Justin. I've read this over at least 10 times. And
we still don't know what it means.
Well, I have a good idea what it may mean. And
okay,
my interpretation is that if you're asymptomatic and you're vaccinated and you're a close contact, you don't have to quarantine.
Would you be subject to those? Was it a minimum of 5 consecutive days of testing to stay?
That is unclear at this point in time.
Okay.
Well, I'm still waiting for finalized guidance, and then I'll have that complete answer.
Wait a minute, I saw Lynn shaking her
Yeah,
head.
Lynn, unmute.
They did say at the webinar it is a minimum of 5 days of daily testing. They haven't provided the protocols yet as far as the, like Kelly said, what the actual criteria is for that, but they did mention that it would be 5 days at minimum of consecutive daily testing for the close contacts. So they would essentially test and stay. They would test each morning, they test negative, they stay. They come back the next day, they test negative, they continue to stay in school.
What Justin asked is did they differentiate between vaccinated and non-vaccinated?
No. That would be part of the protocol and the criteria to be eligible for that. I don't have the answer for that yet, but that's going to be released tentatively August 16th.
Perfect.
Thanks.
Well, and again, just to the beauty or the frustration of all this is guidance, suggestions, not a mandate. So if we decided as a group that we wanted to just say vaccinated, you're fine, then we could do that. If we wanted to say that if you're a close contact, you're vaccinated, we still want you to do the 5 days of testing, then I think we could, we're being asked to make all these decisions as a school committee. We can make that decision too, I think.
Brad, just a clarification. When it comes to isolation and quarantine, it will probably be an expectation coming from DPH. So I think there will be a differentiation when it comes to that. That's what we had last year.
We don't have it yet. Okay, thank you.
So Justin, your thoughts?
You want me to kick it off, huh? Well, I mean, I've talked with a couple of you guys, but I can share with the group that, I haven't arrived at my decision lightly. I mean, I think if rewind 4 weeks ago, maybe all of us kind of thought this was over, and it wasn't until Delta sort of just surfaced and the surge was happening that, I started paying attention. And when I was looking at the sort of the mainstream media, the news, I was like, oh, geez, we're probably going to open masks again. And then as I kind of looked at the actual data myself and talked to professionals, I kind of continue to come back to that idea where this is this is a pandemic largely among the unvaccinated at this point in time, largely among the older population still. So my head right now is kind of at where, and I also find it interesting that like the national organizations, CDC and the Pediatric Association, what are speaking to a national audience, are suggesting that we need to mask, but with the more local level, Massachusetts Department of Health and DESE, they're saying, well, it can be a local decision. I think that has something to do with the fact that we did a lot of things really well in the Northeast, in Massachusetts specifically, and right here in Littleton. When we look at our vaccination rates, I mean, I'm kind of blown away at how high they are and how well of a job everyone's done to sort of combat this. And to some callers' points earlier, I mean, this isn't going anywhere. Look, we could start in masks this year. Would we need to be in masks next year? I mean, just because the under 12 population is going to have the opportunity to be vaccinated, I mean, some people aren't going to get vaccinated. So how long are we going to be in these masks? I don't know that we need to make a decision tonight. I also know that any decision that we make tonight will probably need to be revisited somewhat frequently as the information changes. But I'm okay with it being a parent choice across the board at this point in time. I think that those that are vaccinated don't necessarily need to wear a mask. And I think that those that are unvaccinated should wear a mask. But I also think that there are some individuals that aren't vaccinated and for whatever reason don't want to wear a mask. I think that that should remain their choice. And I know that that's unpopular among some town residents and even some of my friends. And this is a very difficult decision. That's how I feel.
Yep, appreciate it.
Can I jump on that too? Thanks. Thanks, Justin. I'd like to kind of piggyback on what Justin said. I've taken some notes, so you might refer to them. As Justin said, the guidelines issued by the DESI, the CDC, and the other organizations have been national guidelines. They have not taken into account vaccination rates, case rates, et cetera. And I think we live in a huge country with incredibly diverse population. There should not be a one size fits all. So guidelines are guidelines. And I think Governor Baker left it open to interpretation, as Justin said, for our state and for our towns to determine. So we are very lucky, and more than lucky, we're smart. We live in a town where we've prevented the spread. Our case numbers are very low, thank God. Our vaccination rates are incredibly high. And so I think that we need to look at that guidance, those guidelines, in light of our particular circumstances here in our town and in the neighboring towns and in our county and in our state. Additionally, looking at the numbers, I think the numbers can look scary. Listen, I mean, nobody wants to get this. Nobody wants to get sick, hospitalized, or God forbid, die from it. But we have to look at the numbers rationally. And case rates might be up in kids, but hospitalizations and mortality rates are minuscule. I'm just looking at some data here from this article that was shared on Facebook from WBUR, an NPR affiliate. Less than 2% of all child COVID cases required hospitalization. And this is what it says, 0% to 0.03% were fatal. It's a minuscule amount, God forbid, and were to happen to anyone. Nobody wants that, but again, the numbers are tiny compared to other risks that we face every single day in our lives. If kids do bring home, kids under 12 or over 12 bring home COVID, families are vaccinated. And the Delta, especially variant, is hitting vaccinated people not hard. It's very rare that people are getting hospitalized or worse with the Delta variant if they're vaccinated. And I don't necessarily want to go deep into the efficacy of masks, but I will say that there really are no studies that prove that masks work, and there are no studies that prove that they don't work. It's just impossible to create a laboratory study, at scale that would have enough, mitigate and limit enough of the variables to really test whether they work in a real world environment or not. So it's questionable. We also don't know the long-term effects of mask wearing on kids for many hours every day, 5 days a week. So there's that. And we do know, especially from a couple of recent studies, that masks do keep particles and viral particles, not just COVID, but other things, against kids' skin and mouths. And we just don't know the impact of that. So again, same as Justin, I did not arrive at this conclusion lightly. And I do think we should revisit this over time, especially as we get more data and as time goes on. But I think we should start the school year with masks optional for all kids of all ages, leave it up to the families, and hope that things continue to stay flat, cases stay flat, go down, and we can revisit that as needed over time.
Brad?
Yeah, I certainly agree that we're going to have to be flexible. I think one of the things that that's focusing our conversation only on mask instead of hybrid models and all this other stuff, where any change would take weeks to implement. If our focus is only on mask, whether we're talking about requiring them, changing kind of any settings, if we make those changes, then that we can be really nimble there. So I agree with Justin and Jen about that. I disagree about the policy, though. As Justin pointed out, as a lot of people point out, it's a epidemic of the unvaccinated, which is half our student population. By age group, another third or quarter, either by choice or for other reasons. So 60-ish. I haven't done the numbers, 55-60% of our student population are the ones who are the target of this. And the numbers, our numbers that Katrina was citing earlier, and this wasn't her running a study, this wasn't her, if we wanted to minimize her chart, These are the actual numbers. If the R numbers are now greater than they were last year with a 70-something% vaccinated rate, then we're looking at something that's really serious. And we've heard from callers tonight. We all got dozens and dozens and dozens of emails and people talking about their personal stories. We're hearing from people with cases in children with cases in this town. And I don't like the binary of either of saying that, well, very few are dying. That's true. That's true. And very few are hospitalized now. The number's going up and the trajectory seems to be going up over the last couple of weeks. We don't have a lot of data for this. But everything suggests that, I think this slide said 15% of all cases now are in children. And that's the Delta variant. We don't know about long COVID. There are people in this community, there are children in our schools who can't, for whom having complicated heart conditions or something else could be very, very dangerous. The other thing I would just say is that for me, using as many mitigation strategies as possible that will prevent us from having to take more extreme measures. One of the callers was asking about, well, what are your remote plans? Or if you go hybrid, you'll do that. Anything we can do to minimize that option and to allow teachers to do the work that our teachers have talked about of getting the kids closer together, of keeping them safe and keeping them engaged in fuller classrooms, I think is worth doing. I'm more agnostic about the high school, but I believe we should mask and require the mask as a community response to a community public health challenge to protect those who are unvaccinated.
Thanks, Brett. Timlin, do you have anything to add to our discussion?
I have to agree a little bit with both. This has been a really hard decision to come to, and I know that we've trying to make this decision with just guidance and no like people telling you. I mean, I've looked up numbers and like CDC and the American Academy of Pediatrics are going at this as a whole, the whole country. But Massachusetts is 64.5% vaccinated. And people are comparing us to Louisiana and Texas, where these outbreaks are happening, where they're both, I mean, Louisiana is not even 40% vaccinated yet, their population. So we can't compare ourselves to them. I do know people that have breakthrough cases with them and are not with being vaccinated, elderly that have not gotten sicker. I know that we have to protect our kids, but I feel like if we mandate this, we're taking options away from parents who know their kids can't be educated with a mask on, who can't sit there. I know that a lot of the teachers know, and the administration probably knows who these kids are. So we might be able to give them the waiver not to wear a mask. I feel like the 7th through 12th graders who are old enough and who are vaccinated should have that option, definitely. I'm not sure about the younger kids. But I think, I don't know, I would go back and forth. I just feel like everyone has brought up great points for their case. Like you said, you can find information everywhere for both sides of the coin. So I'm not really sure. I look at it and I say, I think it should be a parent choice. And I think most of those parents who would want their kids masked will mask. And some kids who there'll be kids with, I mean, I have a daughter who's graduated now who is anxiety, and she's happy that college is saying in school they have to mask. But she's happy that she doesn't have to mask right now in the summer with her friends. So I think with the guidance from DESE, they're saying that K through 6, they're highly encouraging it. And 7 through 12, they're saying unvaccinated. But I mean, it would be a motion that I would be okay with, but I'm not sure.
All right.
But I really want to look at it like every couple of weeks to see where our numbers are going to.
Okay. All right. Thanks, Simon. I'm one of those people who really thought that we would be out of this in the fall, and we're still dealing with it. And I definitely see both sides, parent options, and believe me, there is no easy decision. I've spent countless hours talking to many different people, hearing their opinions on it. There certainly is the point that these kids are already interacting. They're already going in and being with their friends, but they're going to probably leave school and be participating in sports and other activities with them. In that sense, I think I would be able to be on board with making it optional for vaccinated students to wear a mask, and for staff. That's kind of what I'm feeling. I do feel pretty strongly that we should keep the unvaccinated population, knowing that they haven't had that, and that it is spreading throughout the younger grades just as well as it spreads anywhere else. I would probably be in support of having a mandated mask policy for Shaker Lane and Russell Street at this time. And Dr. Clenchey, can you just clarify for me, grade 6? Now that's kind of the elephant in the room, because that's most 6th graders are 11 and they'll turn 12 during the school year. Is there a lot of mixing going on in the middle school with 6th graders, or are they more isolated?
Yeah, the middle school concept, 6 to 8, rather than junior high 7 to 9. We wouldn't be having this conversation, but I've had a conversation with the principal, and for a good part of the day, those students are in the grade 6 wing. When they have specials, they would go to other classes and obviously be coming across or walking by students in grades 7 and 8. But we would make a concerted effort to keep them as separate as possible. They would be using the cafeteria to eat. I mean, that's where all of our students have lunch. And again, we would be, when the weather's nice, encouraging kids to get outside and eat as well. So it can be, I mean, we can do our best. It's not as if they're intermixed all day long. It's never a perfect scenario when you have to take one group and do something different with them, but they are unvaccinated at this point in time. Throughout the year, those vaccinations will come around for them when they turn 12, and at that point in time, I see this as a unique situation unto itself. If we went with the assumption or decision more correctly that vaccinated people, or vaccinated students and staff, do not have to wear masks, it's up to them, then we would have to do the same thing, in my opinion, in terms of equity with our grade 6s. So when they were eligible for vaccinating, after they became fully vaccinated, we would ask for proof of vaccination, and then they, in my opinion, at that point in time, they wouldn't be required to wear a mask.
Okay, that's helpful. Okay, at this point, does anyone want to make a motion in regards to grade, or I should say, yeah, Dorothy?
We have 2 questions.
Do we want to take those now, or we've already had the public input? I feel like we've already.
It's up to you. I don't know if you want to take them now before you vote. Or
Already had public input at this point, so I think it's this point we're just gonna go along with the motions.
Okay.
At this point, if anyone wants to make a motion in regards to either 7 through 12 and faculty, or vaccinated faculty, staff, and students, I'll listen to that.
Matt, before we go there, I I kind of want to just expand a little bit, or maybe get everyone else's feedback, is with the high level of vaccination that we have in town, I think that shows that a lot of people are taking this seriously. I think we're going to have a high level of masking. If in the event that we did make it optional, I think we're still going to, in my opinion, we're still going to see a high level of masking. I think we're probably going to see more vaccinated maskers than unvaccinated unmaskers. You know what I mean? Like,
you may be right. Yeah, I don't.
You know, like, and that's something to consider here, because what we're really, if you want to wear a mask, of course you can wear a mask. And in fact, as a school board, we should probably all recommend that, you know, unvaccinated people wear a mask, because that's a responsible thing to do. So I think we're really only talking about a small percentage of the population here, where it's, you know, you're unvaccinated and you want to unmask. And it's not like just because we allow for the opportunity to unmask that all of a sudden everybody's going to show up on the first day of school and no one's going to have a mask. I mean, there's going to be a significant portion of the population that's going to mask anyway. You go in a market basket now, and you know, a lot of those people must be vaccinated based upon the data that we saw tonight. There's a lot of masks in there. I mean, there's just people are doing the responsible thing, and for whatever reason, if some people don't want to put their child in a mask, or there's issues with it, you know, that gets back to my thinking, which is I want to, you know, protect that opportunity for them, or that option. But I just wanted to throw that in there.
No, I agree. I think that most people are very responsible and do take this seriously. My train of thought on this is, one is hearing from the teachers and Ms. Kane regarding, would I rather the students not be wearing a mask or be able to be closer in proximity and being more hands-on at a table in a group? To me, the closer interaction is more important. And if having them wear a mask, which I know is more difficult for some, but I think it's going to be, in general, it's an easy thing to do for most people. There is always, you know, there's some kids it's going to affect more than others. That, and, you know, being a teacher, I've always found it's easier to pull back in our guidelines than it is to try and implement them later on. So if we start off saying no masks for, or optional for K to 6, then it's going to be really hard to implement that later on. Whereas if we implement it at the beginning and we find that data is supporting this, I think it's a lot easier to pull back. That's just my opinion.
Yeah, that's an interesting thought, because I actually think it's, you know, just the inverse. Like, if we start with masks on, how are we going to know when to take them off? If we start without masks and the data changes, and then the 5 of us say, hey, look, I know we gave you the option at the beginning of the year, but, you know, the state of Massachusetts is a different place now. The town of Littleton, the cases are up. We got to put the masks on at that point in time. Or let's, in the event that there is transmission in the school system, we could say, hey, put them on. But if we start with them, I'm not going to know when we're ever going to need to know to take them off. Like, that's a concern of mine. And like, I think if we started last year, 5 days a week, probably would have made it the whole year. We just didn't make that call.
And that's like hindsight, again, is 2020. I'm always going to take the more cautious approach myself. And I think there's going to have plenty of examples throughout the country, throughout the state, which we can gauge how it's moving. And if we see that some of the districts who are open with optional masking and we're not seeing significant transmission, then we can move to that. That's just my opinion. Now, I understand this is again, am I going to be terribly upset? I don't have kids in elementary school myself. So, you know, I'm just hearing what I'm hearing from the community, and I'm hearing both sides. So, you know, I think it could go either way. I'm just more of a cautious person. And again, if it goes to if we say that it's optional, I'll absolutely support that.
Two things. One, I want to reiterate that I strongly feel that we should have touch points throughout the school year. I mean, it makes sense to do it during the school committee's scheduled meetings every 2 weeks where we look at the data and we make adjustments as needed in either direction. I think we all agree on that. Whether we start with masks or without, we should be looking at the data and making adjustments. But I don't think we'll get real data if we start fully masked with a mandate across everybody. And then the other thing is, I do have a question about, and I don't know if it can be answered right now, but if masks are optional, will that affect the way the classrooms are laid out? Will it affect the kinds of interactions, physical interactions that kids can have with each other and with the teachers? It is a question. All things being equal, I would like masks to be optional and, you know, no excessive social distancing. But if it had to be one or the other, I would rather the kids be able to interact and engage with each other as normal and wear masks. So, but that, you know, that's hard for me to know which way to vote if I don't know what the effect is going to be of making masks optional. So that's really tricky.
I'm sorry, Jen.
Yeah, go ahead.
But can we hear, on that note, can we hear from the principals about what the classrooms would look like, masked or unmasked? I mean, even at the high school level and the middle school level where they're in like a science class, will they be able to be near each other if they're unmasked? Will they be able to interact at table time in kindergarten if they're unmasked?
I can certainly start. Timlin, I'm going to ask if everybody can hear me. So my mic for some reason is acting up tonight. Matt touched on this already. As you know, we did receive a letter from our teachers union indicating that they preferred universal masking. And really it becomes a question of how comfortable are our teachers with the decision that's made, and that is going to determine what kinds of things that they feel comfortable doing in their classrooms. And I think we all need to take that into account. If what we're trying to do here is restore as much as we can to normal pre-COVID, then we need to think about that, because again, I've worked with teachers for many years and been an administrator for many years, and their comfort level and anxiety level affects how they teach. And you know, we have to ask ourselves that question. I'm like all of you. I've tossed and turned for a week and a half trying to figure out what the best way is to go. And you know, I still go back to a basic belief, and it's all of our jobs, including the administration, to make sure that we keep our schools as safe as possible for students and staff. So I heard the conversation about, well, if we make it optional, then I guess the data will show if we need to tighten things up. Then I guess the question I have with that approach is, wouldn't you rather try to set yourself up for success? And then if the data show that we could relax some of our mitigation factors, wouldn't that be a more proactive and better way to go? I'm struggling with the fact that we're, and I hate using the phrase throw caution to the wind, but we don't know what's going to happen. We don't have any control over this Delta virus. And I'm like Matt, I would rather err on the side of caution. And I know our teachers feel the same way. If you would, I can continue. I've met with the administrative team, and they feel the same way as well. I mean, we all struggle, and we still do, with vaccinated people. I mean, we don't want to do anything that's going to disincentivize people from being vaccinated. I mean, that would be counterproductive. But, you know, I'm glad, Jen, you asked that question, because it really, I mean, teachers are more effective when they're comfortable in what they're doing. If you add stress to the situation, they're going to be less comfortable and more regimented in how they teach students in their classroom.
I do, you know, Dorothy, I do see more hands going up. So before we move to a motion, why don't we hear from them?
Can I chime in first though, Matt? I'm sorry. While we're on these topics, is that okay?
That's fine, Matt.
No, I just it's not funny. It's interesting to me. Sometimes how we these questions become bigger questions, and in some ways, Justin's portraying this really optimistic view of humanity that that I love to celebrate and usually share. However, I think we, as terms of people wearing the mask and just they'll continue. I did think we saw in a large experiment a month and a half ago when the government said, "Hey, you don't have to do it. You probably still should. If you're unvaccinated, you definitely should still wear a mask." We saw how that played out. People stopped wearing most people stopped wearing masks. And imagine in schools where I'm thinking peer pressure may be a greater element in people's lives than after school, although maybe not necessarily. That will continue to be a factor. And we're not going to have, if this is the case, my guess is teachers will not be charged with enforcing proper mask etiquette. So they won't be saying, "Hey, Brad, pull that up. You know, you need to cover your nose," any of that, because it's just, it's all choice. So I think that's just something we said. In terms of, Kelly, what you were just talking about teachers, like I teach at Salem State. We're requiring all students to be vaccinated. We're requiring everybody to be masked indoors. And if either of those things were different, I know that I, as a teacher, would make different instructional choices. That's me. But in terms of group work, to Jen's point, in terms of, pair and share or whatever education speak we're using, I would do much less of that if I could not guarantee that every student in there was vaccinated and using other mitigation levels. Because I wouldn't want to put them in greater risk or put me at greater risk. I probably wouldn't move around the room as much. There were things I would do as a teacher. I would be more hesitant to be really engaged with the students. And that's just me. It's an anecdote. It's one person. It's a personal perspective. But I thought it might be relevant to this. I'll be quiet now.
All right, thanks. And again, I'm allowing this right now. I'd like to keep these quick comments if we can.
Okay. Matt Greeny, please state your name, your street, and your question, please.
Yeah, hey, how's it going? This is Matt Graney. I live on Oak Hill Road. I don't have a question, honestly. I just kind of have a statement. Like I'm gobsmacked over what I've heard, like the comments that I've heard tonight. It's very hypocritical, honestly. Like I remember being at a town meeting 5 years ago when the vote for alumni came up, and people were giving testimony like in favor of alumni. It's great, like everyone was coming together as a community. And people were saying, someone got up there and said, "Yeah, well, I'm really nervous about taking my kids to games at alumni because, there's these open bleachers and my kid could fall through and get hurt." And everyone stood up and cheered and clapped, and it was like this big moment. And it was like, okay, all right, yeah, everyone supports it. And then now here we are in a pandemic, and we're throwing around stats around, well, only 0.2% of kids are dying of this. What is that? That's insane. This is lunacy. Why aren't we doing whatever we can to ensure that the kids are protected? It costs them nothing. It costs us nothing for kids to wear masks. What's detrimental to the kids is to not be in school. No one disagrees with that. 0 people disagree with that. I saw with my own kids being in quarantine, being home in spring of 2020, what that did to their mental and emotional health. Fast forward to last spring, when they were able to be back in full time, even wearing masks, it was night and day. Why are we even arguing about this? We know there's a Delta variant of the COVID virus. If anyone has even a basic understanding of virology, you know that a virus will mutate. They can mutate, they can become more transmissible, which Delta is. They can become more lethal, which it is. And they can become less treatable, which it is. Why are we even arguing about this? The fact that we're taking this kind of mealy-mouthed stance and saying, well, I don't know, we got to people's choice and blah, blah, blah. They're effective. The only way that you're going to get COVID from a mask is if you wear the mask of someone who has COVID. Anything else is just conspiracy nonsense.
Thanks, Matt. Appreciate the input.
EA, please state your full name, your street, and your brief question, please.
Hi guys, thanks. Matt Abernathy, 512 Newtown Road. Just like the previous caller, I'm absolutely flabbergasted hearing this, guys. You guys are trying to toe a line between the sum total of knowledge of the CDC and experts across the country and people who, by their own admission, don't even believe COVID exists. And you're trying to thread this needle so that you don't get either side upset with you. But those two sides are not equal sides. You don't have to walk the line between the experts and the people who get their medical knowledge from YouTube. Okay, this is in the same way I feel terrible for the parents and for the immunocompromised kids that are unable to be vaccinated and now are going to bed learning that their kids will be going to school with a Delta variant flying around, with other kids that will most definitely be unmasked, because when you lose the ability to institute a mask mandate, even kids whose parents think they're wearing a mask when they go to school won't be wearing a mask, and you'll have no way of enforcing that. So now these immunocompromised kids, think of it this way. If you had a kid that has a peanut allergy in class, would you still go, well, a lot of kids really like peanut butter and jelly sandwiches, and they're going to get they're going to be really upset if they don't get their peanut butter sandwiches. And even though their parents don't believe peanut allergies exist, we still kind of have to make it optional that they can bring peanuts into the classroom. So guys, you ran for office. You talk about leadership. I've heard it from you guys directly. This is your opportunity. I'm kind of getting, a lot of us are getting tired of hearing you guys go, I wish I didn't have to make this decision. Oh, this is a tough decision. You got elected to make these decisions. They are difficult decisions. I don't want to be in your place. I understand that, but it is your job. You ran for it. And if you expect the public as a whole to make the right decision on their own without mandates, you haven't been dealing with the public very long. Thank you.
Thanks. Appreciate the input. One thing I do want to say, Dorothy, I don't want any repeat callers. It's a one turn. So we got 3 here. I just want to take those 3 and we're going to move on.
Absolutely. Clifford Stevens, please state your name, your street, and a quick question, please.
Hi, everybody. It's Clifford Stevens, 5 Fraser Street. Just a statement to back up the last 2 callers on this. I'll take a different spin on this and to say, what's nice about this community is that it does come together. Why can't we be that community that sets the right example to like be the advocate for ending the thing, right? You mask up for the next 4 or 5 months, and to the conservative side of that, Justin, then we can actually remove the masks if we need to. If the numbers are there and we suddenly have 90% vaccination rates, which is basically what we're trying to get to for completely getting rid of this thing, or at least having it be manageable at that point, like the flu, you can do that. You protect everyone at that point. You set the example for a lot of other people around Massachusetts and say, hey, Littleton is actually stepping up and doing the right thing by everyone as a community. And it's not about options about whether kids can handle it or not, or what they can do. You protect teachers, you protect older citizens of our community, you protect the young kids, and anyone who is actually unvaccinated who decides that this thing isn't real, you protect them as well. So you're literally coming together as a community to do the right thing by all, by masking up as much as you can, and you make sure that those teachers can teach as best they can right now. So that's I'm just advocating for that as best as possible. Start conservative, loosen just like we did before. You do that the right way, we aren't coming back to this as much. And we'll set the example for the rest of the state. And that's something that Littleton should do right now, especially with how well we're doing in the education system right now. Ranking up and where we are right now, it is honorable to be part of Littleton. And you should take that honor and ride with it. I'll leave it at that. Thank you, everyone. And thank you all for working so hard on this. But please vote to mask to start the school system.
Thanks, Cliff.
I'll take the next 2 questions.
You can take Danette too. We haven't heard from her.
Okay. Erica Podgorny.
Hi, Erica. Hi, can you hear me?
Yes, go ahead, Erica. Sorry.
Erica Podgorny, 6 Fox Lane. 2 quick things. First, if you vote that vaccinated students and staff don't need to mask, there's no way to enforce that. HIPAA laws do not allow teachers to know who is vaccinated and who is not. So in the school, nurse is not sitting in on classes. So there's no way to enforce who is wearing masks and who is not. And if any of you have ever gone to middle school or high school, peer pressure is not going to allow those kids to make the right choice. Kids are going to see their peers not wearing masks and they're not going to wear them. And what parents want is not going to be a factor in that. My second thing is I'm a kindergarten teacher, and you talked about whether or not masks would change how you teach. And I will just say, from my point of view, my number one job is to protect the safety of my students. And it absolutely would change how I teach. If my kids weren't wearing masks, I would keep them apart. It is my hope and my goal to have kids at tables doing cooperative activities this year. But if they are not wearing masks, I will not do that. It is my job to keep them safe. Thank you.
Thanks, Erica.
Carrie
Eric?
Lavoy, please state your name, your question, and your street. Oh, it looks like we have Danette here. I'm sorry, Carrie. Danette Johnson.
Yep. Hi, Danette Johnson, Brook Lane. So I have 3 kids in the school and I do work at Shaker Lane. I guess I'm backing up the last couple callers. We need to be conservative because when we talk about, oh, would it be harder to put the mask back on or take them off? We're also talking about people's health and their lives. This is not, and I know you guys all take this seriously, but we need to be conservative. Katrina really laid it out for us, and we need to take all these experts' opinions seriously. If it is optional, then my child wearing a mask is not going to protect them. It's going to protect everybody else. That's how the masks work. They protect you and others. So half of the kids wearing masks and half not is not going to protect everyone. The other piece is it's going to be difficult for teachers and educators to do anything about it. I'm going to have to go to my second grader's classroom teacher and say, no matter what he says, he needs to keep a mask on. So that's not something all parents are going to want to do. It's not, they shouldn't have to. It's going to be impossible for educators to police this if it is optional. I mean, I guess that's part of the point, but even if I want my kid to wear a mask all day, I can't do anything about it and the teacher can't do anything about it. I think we just need to try to keep them safe, and hopefully if we all wear masks, and heavens knows I don't want to wear one anymore, if we all wear them, we can get through this together. So that's my opinion.
Thank you, Danette. What's going on here? Hold on.
You know how to work that thing, Dorothy?
Sometimes it's the callers that are coming in. Shana Garwisi? Nope, she's off. Carrie Lavoy, please state your name and your question. Carrie, go ahead. We'll get Shana after. You're muted, Carrie.
Hi, can you hear me?
Yes.
Hi, my name's Carrie Lavoy. I live at 3 Stony Stream Lane in Littleton, obviously. I am very concerned at the way that this school committee meeting has kind of turned. I turned on tonight thinking, oh, they're definitely going to be masked. We are a very educated community. We're doing all the right things. We are going to stay masked, especially for the little ones that don't have the opportunity to be vaccinated yet. Shaker Lane and Russell Street absolutely should have a mask mandate. And I don't think it's fair to put a teacher in a position of trying to remember which children are supposed to be masked and which children are not. I think they have so much on their plate right now. That's not something that they need to be doing. And I think that if you are going to have it up to the parents, are you going to open up classrooms to parents that are only masked? It's important to me to have my children masked. I am a very high risk person. If they bring COVID home to me, I could die. I have a very serious heart condition. Are you guys willing to take that risk with moms and kids? I mean, there are kids in this town that have siblings that have cancer, and there are really immune compromised children and family members that you need to protect. And the vaccinations do some part, but you are talking about not protecting 60% of our school committee and their families. That's not even counting in this Delta variant. That's very scary. I haven't worn an N95 mask through this entire thing, and I just ordered $100 worth for myself for when I do errands. I actually am more afraid now than I was last September sending my children to school. And I certainly didn't expect that when I turned into the school committee meeting. I really am hoping that you put these last several calls in your minds when you put this vote. I thank you guys for all your time and attention. This has not been an easy tenure of the school committee meeting, and I do thank you. But you are putting people in the position of, instead of being excited for their children to go back to school, for them to be, honestly, I'm thinking more about homeschooling than I was last year. And that's scary to me. My children need to be in school. Their mental health needs them to be in school. The children that cannot be vaccinated absolutely need to be masked. I think that the entire town should still be masked in the buildings, at least to start, or until Delta is under control. Thank you guys for your time.
Thanks, Carrie. Looks like we have one more. We're going to cut it off right there. Take Brandon, and we're going to have to move on.
Last question. Brandon, please state your name, your street, and your question, please.
Hey, Brandon Gustafson, 31 Grimes Lane, Littleton. Good evening, everyone. Certainly appreciate all of the opinions here. Certainly turning the tide at the end here from opinions at the early beginning of the call to the end. Certainly interesting as we hear it go through. I just, I actually want to kind of provide some counterpoint to the last couple of callers and just say what a great civics lesson this is if you've got kids listening on mandating things through a government entity. You think about cascading that through the nation, or even as we think about our own individual families. And I strongly feel like in each individual parent, as we assess risk on a daily basis, should have the ability to assess that risk for our families and for our kids. And I would vote, if I had the option, to allow for vaccinated people who took the vaccine to be able to not wear masks or have them be optional for them. And if people still choose to wear a mask, that is perfectly fine with my family. So, it's important, I think, that it's not something that gets mandated. Certainly we will follow whatever's voted, but certainly feel like, the right thing was to get the mask, was to get the vaccine. Those of us that have done that, as we talked about from the data at the beginning of the call, that should be rewarded with not having to wear a mask. If we say to people that have gotten the vaccine, you just need to keep wearing a mask, there was really no benefit to getting the vaccine. So, clearly my opinion, I'll leave it at that, but I would vote for parents' choice. Thank you.
Yeah, Dorothy, I want to take Kevin Baker just because he's a member of the Board of Health.
And Shayna, we cut off, so I don't know if you want to go with that.
That's it. Those two.
Okay, that's it. This is the last. Shayna first, then Kevin. One moment. Shayna, I have to pull you up to the panel. Shayna Garlisi, you there?
Hi, can you hear me?
Yes, go ahead.
Shayna Garlisi, Boxwood Drive. I also teach at Shaker Lane, and I just wanted to echo what Brad had said earlier, as well as the kindergarten parent who had called in, who's also a teacher, that I will certainly teach differently if our kids are masked versus unmasked. I feel like as teachers, our number one job is to keep our kids safe. And that's something that we share with them throughout the school year when we have our safety drills, our lockdown drills. We are always reiterating to them that our number one job is to keep them safe. And I think that as educators, knowing that the Delta variant is significantly more dangerous, I would say, than the original COVID in terms of it's more easily spread. There are other areas of the country where rates are higher than us right now that have full ICUs, both pediatric and adult. So we know that this is impacting kids in other parts of the country, and it's only a matter of time before it can seriously impact our own community if we're not taking the proper steps to mitigate it. I know that there were several families in town who have already spoken or called in and mentioned that they themselves are immune compromised, their children are. I have family members that are, and I made the decision last year and was fortunate enough to be able to teach in a remote classroom to help protect my family, but even that did not protect my closest family member. So I think that this is something that is very personal for some people. It's impacted some families more than it's impacted others, but I think that this new strain that's currently very active in our state and getting closer and higher impacted in our community than we were at this point a year ago. And I think that it's something that we do need to take into consideration. Having our students masked means that they can interact with each other. They can get the social piece of school that they were missing out on for so much of last year, whether they were hybrid or remote. Having them unmasked means that we need to keep them distanced. We can't be sharing materials in the same way. I'm going to feel more nervous running a group or a reading group, keeping them spaced out, trying to remember who's supposed to be in a mask and who's not, versus just getting down to letting the kids interact with each other and learn in the way that they need to. I think there's a comfort level. The students have been in masks in school the entire year last year. So it's not something that they need to all of a sudden get used to. They are used to it. And it just feels like the safest decision would be to start with masks. And when it's safe to do so, remove the masks. It's always easier to start with more regulations in place and take them away as we no longer need them than to implement them later on. It's the same thing that we do as teachers in terms of our classroom management. You're stricter in the beginning of the year with enforcing rules and getting kids to learn and follow classroom routines. And as they show that they're more capable of that, you relax it a little bit and give them more freedom and more independence. And I think that that's the approach we need to take with masking here so that we keep all students safe, all teachers safe, and all other family members safe that can be significantly impacted if this Delta variant comes home through school.
Thanks, Shana. Do we still have Kevin or?
No, we don't. Oh, wait, here he is.
Amazing.
It wasn't me. Kevin Baker, you there? Kevin, you muted? There you go.
Hey guys, how you doing? I just wanted to say thank you for everybody dealing with this crazy situation we're in. I think that, speaking as a resident, we just have a moral obligation to implement as many mitigation strategies as possible to keep everybody healthy. And I put that on you guys, and I know you'll do the right thing. So thanks.
Thanks, Kevin. All right. At this point, I'll open it up to motions.
So I will make a
Pretty quiet.
motion. May I make a motion?
go ahead.
Let's see. I'm going to make a motion that staff and students grades 7 to 12 be masked, optional if vaccinated, and students and staff in 6th grade and under be mask mandated.
I'd like to.
What about 6th graders that are vaccinated? Breaking it down by grade seems, I don't know.
Why don't we do this? I'd like to take a motion on Shaker Lane and Russell Street first.
Okay. I'll make a motion that Shaker Lane and Russell Street students and staff be masked.
I'll second that motion.
Motion made and seconded. I'll start with Brad.
Brad Austin votes yes.
Jen?
Can I just make a comment before I vote?
Yep.
Is that allowed? Everybody knows I'm new to this. I'm extremely emotional right now, to be honest. It's a little embarrassing. This is really hard. I'm not asking for sympathy. One of the callers said he's sick of hearing us talk about how hard this is. It is hard. I'm sorry you're sick of hearing that, but this is hard. I've lost a lot of sleep over this decision, and I came into this thinking one way, and I honestly hearing from the teachers, and hearing from Mrs. Kane about how difficult it's going to be to teach in an environment where it's mixed and it's optional. And my kids are both under 12. They'd be in that kind of environment. Get it together, Jen. I don't want to impact their day-to-day education. I have this utopian vision of some kids masked and some kids unmasked, and the teaching being perfect and normal and everything going on as we all dream it will be someday again, and that's just not reality. And so I think it's more important that the kids get a normal education as much as possible. And if that means they have to all be wearing masks when they're unvaccinated, then that's what I'm going to vote for. So I vote yes.
Emily?
Yes.
Justin?
I'm in favor, but point of clarification, at some point, it's entirely possible that population will be eligible for vaccine during the school year. And it's maybe irrelevant because I think today's August 11th, we're talking about how we think we're going to start the school on, when do we go back, September 6th or something. So, I'm fine with it. Like those two schools, we can say, hey, listen, masks are mandated to start the school year. I think it's something that we need to revisit once vaccination becomes available to that population.
Agreed.
Is that part of the motion? Was that the thought process behind the motion?
Understood that we're going to be revisiting this frequently and as things change. It's a very fluid situation. So the vote is yes, or just so we have it for our record?
Yes. Justin McCarthy votes yes.
Okay, Matt Hunt votes yes as well. The second one I would like, you can go either, you can say something as to the point of middle and high school are mask mandated. You can say that vaccinated students at the middle and high school it is optional, but I'll accept either motion.
Just point of clarification, we keep saying middle high school, but we really mean age 12 and up. To Jen's point.
I think that we're just going to go with vaccinated versus unvaccinated, since there are going to be some transitional kids in 6th grade who are already 12. And you can include faculty in that. So,
Matt, just a point of clarification here. We're seem to be focusing on students, yet the first motion included staff as well. I just want to make sure you all understand what you're doing, because now we're going to the high school, and depending on your vote in the high school, you may have to, in my opinion, revisit that motion because you included staff and students in it. So
I didn't catch that, but.
Oh, was I not supposed to? I can change my motion.
Well, we started with schools, and then now we've shifted towards the vaccinated, unvaccinated. So
at this point, just be students. So can we change that to change that motion?
So my first motion that I made is students at Shaker Lane and Russell Street to be mask mandated beginning the school year. And we'll go back and check data frequently to see if we can lighten the mandate.
Can you need a second?
Second.
Motion made and seconded. Brad?
Yes.
Jen?
Yes.
Finland?
Yes.
Justin?
Yes.
Matt Hunt votes yes as well. Now I'll take a motion in regards to the middle school high school and staff.
I'll make the motion that vaccinated individual students and staff are exempt from a mask mandate. All those that are unvaccinated would be required to mask.
I'll second.
Motion made and seconded. This is a roll call.
Can we have discussion now that we have a motion and a second? Because I'm unsure about how this will possibly be enforced, especially given a caller, it may have been Erica, who said something about, and I don't know if it's true, so this is basically a point of clarification maybe for Kelly or someone else about whether teachers can know their students' vaccination status. And so I have questions about the practicality of this. The wisdom of it's a different discussion, but the practicality of it, if we adopted the policy as moved and seconded, can we enforce this policy?
Thank you for asking that, Brad. I mean, as I pointed out earlier, we can ask for proof of vaccination, but once we get into what actually happens in the schools, I mean, a high school teacher, for example, has a class size or a case size or whatever word you want to use of about 150 students. So it is very difficult to monitor throughout the day. They're going to a number of classes with different teachers, etc. So it's not going to be easy to monitor this once we have proof of vaccination. So it will be a challenge.
Thank you.
All right, motion made and seconded. I'll start with Timlin.
Timlin Rausius, yes.
Brad,
Brad Austin, yes.
Justin,
Justin McCarthy, yes.
Jen,
Jen Gold, yes.
Matt Hunt votes yes as well. So,
Matt, just sorry for interrupting. There's one piece of unfinished business now.
Yep.
You voted grade 7 to 12 staff. If they're vaccinated, they have a choice of wearing a mask or not. We now need to take care of Shaker Lane staff.
okay. Yeah, what about Russell Street?
Yeah, I'm sorry. Yeah, Russell Street and Shaker Lane.
Point of clarification, didn't the motion include the 6th graders that would be vaccinated? Isn't that how it was worded? We were talking about the 2 schools, and the motion was all individuals, vaccinated students and staff would be exempt from the mandate. I think that's how it was worded, was it not?
No, it wasn't. The first motion that you voted on stated that all students and staff will wear masks at Russell Street and Shaker Lane.
Yeah, I'm good with that one. When we moved on to the middle school and the high school.
No, then we retracted that. We retracted that motion, and I made the motion that it was just students.
Right.
So, I'm sorry, I'm talking about the motion that I made, which was, I got that. We're good with the first 2 schools. We screwed it up once. I think we fixed it. You were just Kelly, you were just asking about the 6th graders, and I thought we already talked about the 6th graders.
I was asking about the staff at Russell Street and Shaker Lane.
Okay.
That's
great.
Don't have a vote
on that. Something to make a motion that vaccinated staff at Russell Street and Shaker Lane have the option of wearing a mask.
Second.
I can't make the motion. I'm telling you. So I'm just giving you an idea.
Okay, then I'll make the motion that the staff at Shaker Lane and Russell Street, if you're a vaccinated individual, the mask mandate is optional. If you're unvaccinated, there would be a mask mandate.
Second.
Brad. Motion made and seconded. Brad.
Brad Austin, yes.
Timlin.
Timlin Rausius, yes.
Jen Gold, yes.
Justin.
Justin McCarthy, yes.
Matt Hunt votes yes as well. Again, I think this is a fluid situation. We do have 3 weeks until, a little bit more than 3 weeks until school starts, and we'll have ample time should we see any major changes to revisit that, but regardless, we're going to be revisiting this throughout the school year.
Matt, Steve Mark has a question.
Sure, Steve.
Yeah, thank you. I just want to remind everybody at the middle school and high school level, and all the levels, just remind everybody that masks are required on the buses, no matter if you're vaccinated or not. So if you're a high school student and you drive to school and you play sports and you get on a bus to go play sports, make sure you have a mask. You have to wear a mask anytime you're on a bus. Thank you.
Thanks. Okay, now I think to your point, Brad, about requesting proof of vaccination. I think you had a question about that if we voted to go this way.
I did. I understood what something Kelly said earlier was that he did not think he had the legal guidance that would allow him to ask that question. And if he did have that guidance, that he thought he needed this committee to instruct him to, or to ask him to. Is that correct, Kelly?
Yes. Up till yesterday, we wouldn't have that opportunity to ask that question. But again, the legal brief is opinionated. It's not case law supported. Could be. So if you would like us to ask for proof of vaccination, point of clarification, Brad, is this for staff or students or both?
I wasn't making a motion. I was asking to see what clarification, what instructions needed for us. I'm thinking it's particularly about staff because I think that's where the guidance. I guess the guidance does apply to students as well. I don't know. I personally would like, if we're going to make decisions that have public health ramifications about, and it's going to be vaccinated, non-vaccinated, you have different requirements, then I think we should ask.
And
that's me. I may not.
In order to do that, I would need a motion clarifying that, and then we'll have further conversations after the motion is made.
Excuse me, I don't mean to interrupt, but I just received a text message that the meeting shut off on LCTV,
Oh my goodness.
that we are no longer being broadcast. Judy?
We're only 3.5 hours in.
That is true. It's not on
I'll
TV
go
anymore.
fix it. I gotcha.
Halfway there, Brad.
Thank you, Judy. No more speaking, please.
Shouldn't have cut off. But... Obviously, still working on it. This is new. My apologies to everyone for pausing this late.
Judy, I believe it's under another department.
Oh, good point. Thank you.
Yes.
I believe you are
We are back.
live.
Okay,
Yeah, went live on the Education Channel.
okay. Thank you. Okay, we're good.
Good to go.
So I think we're discussing giving administration either permission to request vaccination status of staff and students. Is that correct?
Yeah, we're going to need it, obviously, if those individuals don't want to wear a mask.
Right. So
it's kind of going to take care of itself, unless you simply want to ask people that are choosing to wear a mask whether or not they're vaccinated. And I don't know that that's necessary. We have the town data. You were just trying to get the staff data, right? So you're really just trying to figure out if masked staff are vaccinated.
Matt, I'll move that we direct administration to ask staff and students for their vaccination status, so that we can implement the policies we've just discussed.
Could I suggest an amendment?
Yes, please do.
That we ask for proof of vaccination for both staff and students.
I'll accept that amendment.
I will second that amended motion.
Motion and amendment made and seconded. This is a roll call vote. Timlin,
Timlin Rassius, yes.
Jen,
Jen Gold, yes.
Brad,
Brad Austin, yes.
Justin,
Justin McCarthy, yes.
Matt Hunt votes yes as well. At this time, this brings us back to our last opportunity for interested citizens. If anyone has any. You have James.
Hi, this is Jamie Kennedy from 50 Gilson Road. My question is, now that we've voted that vaccinated staff members can have mask optional, does that mean as parents we can ask that the teachers that are interacting with our students wear their masks?
Kelly?
The motion gives them the option. The direction comes from the school committee. I mean, anybody can ask them, but it would be their decision with the motion that passed.
Or are we moving on to Christy?
Hi, this is Erica Podgorny, 6 Fox Lane. So I guess I would like to go back to my question before and ask how this vote that you took will be implemented. Will teachers get a list of who is vaccinated and who is not? Because it is my understanding as a teacher that I am not allowed to have that information.
I'm going to simply say at this time, I will be checking with legal counsel for verification of that. The legal brief did not go beyond the fact that we can ask for proof of vaccination.
Okay.
Christy?
Christy Alman, please state your name and your question, please.
Sure. Christy Alman on Gristmill Road. My question is just, when you did the motion, was it for all of middle school or 7th grade and up?
It was for vaccinated students at, I believe, in the middle school, because there are some transitional kids who may have been vaccinated.
Okay, cool. I just couldn't tell if 6th graders were still unaddressed or if they were lumped in with, if you had done the whole school. That was my only question.
Yeah.
All right, thanks.
Thank you. No more questions.
All right. Do we have any other business before the school committee, Dr. Clenchey, before we take a motion to adjourn?
No, we should be good.
Okay. At this point,
Matt, I'd just like to say I'm really excited about our retreat tomorrow.
yes, we do have a retreat tomorrow. It's going to be for most of you guys, this will be your first retreat. Did we have a retreat last
All
year?
of us.
No, we didn't have one last year. Okay. Yeah, so you guys are in for a whale of a time, as Whalen Park used to say. So again, we will see how the decisions we made tonight, how they go into practice. And again, I appreciate all the discussion we've had tonight. I don't think all of our callers, we appreciate your input. And at this point, I'll take a motion to adjourn.
Make a motion to adjourn the meeting.
Second the motion.
Okay, motion made and seconded. This is a roll call vote. Justin?
Justin McCarthy votes yes.
Emily?
Timolin Rossius, yes.
Jen?
Engold, yes.
Brad?
Brad Austin votes yes.
Matt Hunt votes yes as well. Thanks, guys. Have a great evening.
Thank you.
Thanks.